Good evening, everybody. It looks like I'm 5 minutes late. We are attempting to connect from the office. My apologies on that. September happens to be a prostate health awareness month, which almost means that we need to come out of box apart from continuing to treat and continuing to help patients, colleagues across the table. We also need to get into the picture of going to the society and making them aware of diseases which may not be known to everybody. I carry greetings from Kokila Bindhirubhai Ambani Hospital, where we follow every life matters. And why everybody follows that motto, every life matters. So I think we represent a larger picture of importance of life and importance of diseases. The kind of diseases that you go through are obviously two kinds. One is those which are life-threatening diseases, the other are quality of life diseases. Today, we're going to attempt looking at an organ and take it forward while more colleagues join around who requested I could start slow. I present to you the Dream Team Urology, where I'm a part of. I'm sitting in the Department of Urology at this point in time on a Sunday afternoon. While you prepare your cup of tea, which ladies will hand you, you're actually preparing to know about your body, which is the organ called prostate. So that's the Dream Team, which works around, and me, Dr. Bijoy, Dr. Smile, and the entire men in blue behind are the motivators of the entire aspect of urology, which goes on 7 days a week up here. The purpose of today's talk is to spread awareness in the society about positive prostate health, a very important aspect that I need to bring to everybody. All men have that organ called prostate, and it's important for us to take this subject to the highest possible levels in a short while, which means that I salute each of you in this audience for having come in, having in fact invested your Sunday evening to spend time to understand an organ which you already know a lot by your colleagues, by your doctors, by Google. Today is more of an awareness to make you aware really about changes which happen in our body. So as people adjust to progressive various urinary issues in life, there are times when health hazards could happen. It could be prevented if you could possibly know more about it. So seeing your doctor towards improved health on all aspects, and more so in urinary health, is something that's important, and we will touch base on that. So who is a urologist? If I'm a urologist, I'm the one who deals with medical and surgical diseases of the kidneys, adrenal glands, which are just above the kidneys, ureters or the narrow pipes, which actually transmit urine from the kidneys down to the urinary bladder, the receptacle. And then comes the male organ called a prostate, and then the conduit called the urethra, which helps us to actually empty our urine on a time basis across the day and the night as a bladder fills up a sensate organ. So what does the urologist do across this country and the world? He deals with systems which are going to deal with the urinary and the genital system of human beings, men and women. We are looking at being a urologist. It's important for us to bring about that important dial U for urology. You can see that big U, which is a chain that you have agreed to come on board today to bring about the understanding on the bend of the road, where you're taking a subject of huge degree of specialization and probably would understand more today and would go back home with the purpose that you came in today. So look at what kind of individuals do present to a urologist across the country and the world. I represent the Urology Society of India, whose member I am, and of various other societies where urologists work on both the routine and the emergency kind of cases around. The whole aspect today is to look at how to prevent emergencies. So let's look at what kind of individuals do present to me or present to a urologist. I am passing urine whole night. That means I get up at night, I pass urine, I go to sleep, but then I get up again and pass urine. There's one aspect how patients pass urine. I have to search toilets, otherwise I may leak urine. Sadly, that's something of overactivity. I can't control urine before I reach the toilet. I pass blood in urine, which is completely abnormal. I'm taking a long time to empty my bladder. I always feel I have incomplete emptying of urine. I sometimes pass urine in bed. That's an embarrassing and a sad situation. I am passing urine in drops, and I pass urine 20 times a day. And I have got kidney stones which are not troubling, and holding urine is very painful in the bladder. अगर इस तरह की मुश्किल किसी को होती है, तो हमारा मानना है कि यूरोलॉजिस्ट के पास बिल्कुल टाइम पे जाने की जरूरत है. वो आप जिस शहर में भी रहते हैं, जिस देश में भी रहते हैं, आपके लिए अपने यूरोलॉजिस्ट के पास जाने की जरूरत है. अगर इस तरह की कोई भी यूरिनरी कंप्लेन है, उससे पहले ही दिन निपटाने की जरूरत है, बशर्ते वो रविवार का दिन ना हो. So on a routine basis, a urologist in his outpatient department would see many such cases. Many of these cases could actually be an emergency. So हम आगे बढ़ते हैं और ये समझने की कोशिश करते हैं कि सोसाइटी और मेडिकल के बीच में कितनी आदान प्रदान की जरूरत है, कितनी इंफॉर्मेशन की जरूरत है। आज जब आप इस मंच पे बैठे हैं जहां आप ये जानने की कोशिश कर रहे हैं कि यूरोलॉजी क्या होता है और प्रोस्टेट की इशू क्या होती है, मेरा ये मानना होगा कि मरीजों के साथ या सोसाइटी के साथ हमारा जो एक गठबंधन है, जो एक तरह की अंडरस्टैंडिंग है, वो इतनी स्ट्रांग होनी चाहिए कि आपके कंप्लेंट्स डॉक्टर के पास टाइम पे पहुंचे। अगर आप उसे पोस्टपोन करते हैं तो एक टीम वर्क वैसा नहीं हो पाता जैसा एंड रिजल्ट आता है जो दिख रहा है। So end result of any good thing will be good provided we move in time with a plan and an approach. Therefore, we become self-sufficient, we are vibrant, and we are empowered, possibly because we are aware today and we have a knowledge of the subject which we need to. So to me, understanding diseases and patients in this 24 years in urology, since I started doing urology in CMC Vellore and Jepma Pondicherry and served in Sri Ramchandra Medical College as associate professor for a decade. Before I came into this building in Mumbai 12 years ago, it feels that the message is loud and clear. Every patient can dance to the tune of his dreams. That means he can maintain his health and improve the quality of health, though he is on a razor sharp edge all the time because changes are very silent and very gradual. Therefore, in today's world, the society needs to make important changes in the goalpost of understanding the subject, not necessarily always by Google, but also knowing your colleagues who are doctors, your family members who are doctors, and possibly investing yourself in medical fraternity work, which we get into 24/7. So understanding these in patients in these years has been a challenge to me because patients always present late. They always present late because the complaints that they had a week, a month, or a year ago possibly is presented quite late, either in emergency or they walk in for a second opinion. So today in the modern era where we live in and in 2020, where the lockdown has brought so many changes, one important change which lockdown has brought is we understand ourselves better. We know ourselves better. We think about ourselves more. We are more self-reliant. We are more, I would not say selfish, but more observant about ourselves. And it's nice that you are. If that is what it is, you're investing yourself today on a subject which will move forward. So graceful aging and urinary health issues are not known, but that happens to be a burden later on in the society because there are so many people who are aging gracefully. They are mature, they are experienced, and they have got expectations. They evolve into a different body from the body that they had when they were younger. And that kind of changes which happen around is what we're going to discuss the next 45 minutes. We always had miles to go. While everybody is on his acceptable therapy, as if people take medicines from doctors whom they know well, or a family doctor, or probably specialists in various cities around, we always know that that may not be the end. What got us here will not get us there, which is from treatment to the word cure. You're looking at cure, you want to get well. अगर बिल्कुल ठीक होना है और अपनी बीमारी से दूर बहुत दूर जाना है, ये बहुत जरूरी है कि it's a wake-up call like life comes a full circle. You know the subject better if you probably immerse yourself and get into a deep soaked immersion training like the one we're going to go on. So you live only once, and all those who deal with health, which includes every human being in the society, today is really a wake-up call. It's only to make that important connection of the dots between diseases and society. That means not to scare anybody, but make people aware that it can happen to us tomorrow. But not to worry, this body can be polished and painted so well that finally at the end of it, you are again brushed up and you're back on your feet when diseases do strike. And that's where medical fraternities, doctors, hospitals, healthcare teams across the country are fighting now more efficiently because of the virus, which has taken care of this entire world and brought us back to the knees. But otherwise too, we continue to fight it out. On the urinary system that you see out here, you're aware of it, and this system is not unknown to anybody. To me, if I get a chance to point out, you have got your kidneys, which are at the back. The kidneys are always at the back. So it's me who's pointing out the slides. So you have got normally 2 kidneys, but 1 in 4,000 individual is born with only single kidney. So let's go down there. That means if you're born with a single kidney, you can still do very well, which is the motto of organ donation in life. That means you can donate 1 kidney and can still do very well. The medical fraternity decides which kidney to take. You only have 1 heart and 1 liver and 1 lung, 2 lungs and 1 brain. So those things are a little different in a purview. But there are 2 kidneys which are at the back of your body. And then the narrow tubes which come down from the abdominal root all the way to the pelvis to serve the function of a conduit, which actually drops the urine down into the receptacle or the bag, जिसे urinary bladder कहते हैं. So urinary bladder पेट के नीचे वाले हिस्से में होती है जहां हम यूरिन स्टोर करते हैं. ब्लैडर का अपना एक दिमाग होता है. So एक गॉल ब्लैडर होता है जो पीत की थैली होती है, जिसकी आज बात नहीं हो रही है, पर एक यूरिनरी ब्लैडर है जो यूरिन स्टोर करती है. ये बहुत ही इंपॉर्टेंट संदर्भ है हमें जानना है, बिकॉज ब्लैडर का अपना एक दिमाग होता है. जब आप आराम से बैठे हुए हैं, अभी चाय पी रहे हैं और इंतजार कर रहे हैं, तो ब्लैडर धीरे धीरे ड्रॉप बाय ड्रॉप दोनों किडनी से भर रहा है। और जैसे जैसे ब्लैडर भरता जाता है, वो एक रिसेप्टेबल की तरह एक लेवल तक भरता है, उसमें एक सेंसेशन रहती है। वो सेंसेशन जब फुल सेंसेशन को जाता है, तब ब्लैडर बोलता है बहुत हो गया ये लेक्चर, अब जाके जरा यूरिन पास कर। उस समय ब्लैडर अपना वो फंक्शन छोड़ के दूसरा फंक्शन निभाता है, जिसमें ब्लैडर कॉन्ट्रैक्ट करता है, यूरिन को पुश करता है, और फिर यूरिन यूरेथ्रा के द्वारा, यूरिनरी पाइप के द्वारा बॉडी से बाहर निकलती है। सो किडनीज फिल्टर एंड प्रोड्यूस यूरिन, यूरेटर्स ट्रांसपोर्ट द यूरिन, bladder stores urine, and urethra exits urine. That's how computerized God made. That's the biggest computer ever made by anybody around. That's how it is. So the anatomy is about, where your kidneys are at the back, and the urinary system is very well served. In all this which happening around, we're looking at men today. So today is all about men's health and about an organ only. And that organ, prostate, is hidden deep inside. People sometimes forget that prostate is not one which is hanging from the men's body. Prostate is deep inside the body, deep inside the pelvis. It's a tip of a finger of the index finger of a urologist, which is trained to feel, palpate, and probably talk about the size of the prostate or about changes which could be cancerous, all about by the examination through the rectal route or the motion passage. So prostate gland urinary bladder के बिल्कुल नीचे होता है, आपको दिख रहा है, ये urinary bladder है जो हमने ऊपर दिखाया हुआ है, जो अब मैं एनोटेट कर रहा हूँ, और उसके ठीक नीचे जो urinary passage को कंटेन करता है, उसे prostate कहते हैं। यूरिन इस पैसेज के थ्रू यूरिनरी पैसेज में आता है। सो प्रोस्टेट एक अहम अंग है जो एक एग्जिट पे होता है। एक सेकंड के लिए हम ये भूल जाएं कि सिर्फ प्रोस्टेट की बात कर रहे हैं, तो यूरोलॉजिस्ट इतनी सारी डिजीजेस से डील करते हैं। वो जन्म से कुछ डिजीजेस होती हैं जिसमें कुछ अंग मिसिंग है या कुछ अंग डेफिशिएंट है। एडोलेसेंट उस उम्र में जब कुछ हार्मोन की चेंजेस हो रही हैं, कुछ चेंजेस ऐसे होती है जो डेवलपमेंट में पूरा डेवलपमेंट हो नहीं पाया, तो ये 11-12 साल से 15-18 साल के बच्चे जो हमारे पास आते हैं, जिनको यूरिनरी इश्यूज होती है, बेड वेटिंग और टॉर्शन टेस्टिस और किडनी की यूरिन रिफ्लक्स होना, और फिर एडल्ट्स आते हैं जिनको यूरिनरी इन्फेक्शन के द्वारा हम देख पाते हैं, औरतों में यूरिनरी इन्फेक्शन ज्यादा होती है, पुरुषों में इन्फेक्शन थोड़ी कम होती है लेकिन बहुत जानलेवा होती है। और फिर हम पुरुषों की प्रॉब्लम को अलग से देखते हैं, और फिर देखते हैं उन एपिडेमियोलॉजिकल डिजीजेस को जिसको हम स्टोन की डिजीज कहते हैं, प्रोस्टेट की डिजीजेस कहते हैं, और सीवियर यूरिनरी इन्फेक्शन कहते हैं। सबसे नीचे जो मैं लिखा है वो सबसे ऊपर होना चाहिए, लेडीज फर्स्ट, फीमेल्स जिसमें ओवर एक्टिव ब्लैडर, यूरिनरी लीकेज और अन्य तरह की बीमारियों के बारे में बात होती है। तो इन सब चीजों को यूरोलॉजिस्ट देखता है। पर इमेजिन कीजिए सितंबर वो महीना है जहां हम प्रोस्टेट हेल्थ के बारे में बात कर रहे हैं। प्रोस्टेट के ऊपर जो ऑर्गन है यूरिनरी ब्लैडर, इसकी ट्रेमेंडस कैपेसिटी होती है बलून की तरह। ये यूरिन को स्टोर करता है और यूरिन को खाली करने की जो काम करता है, जो मैंने आपको बताया, एज अ बैग इट कंट्रोल्स, इट हैज अ सेंसेशन एंड इट compresses and puts the urine out through the organ called the prostate in men. औरतों में प्रोस्टेट नहीं होता है, तो औरतों में एक ऑर्गन कम होता है, पर उनमें दूसरे ऑर्गन्स होते हैं, जैसे यूट्रस और ओवरी वगैरह। यूरिन अगर कंट्रोल ना कर पाए, जो किसी भी अवस्था में किसी भी उम्र में हो सकती है, जैसे यूरिनरी इनकॉन्टिनेंस कहते हैं, जिसके बारे में आप अपने यूरोलॉजिस्ट से मिलते हैं, वो बहुत जरूरी है। तो इस संदर्भ के द्वारा हम जब आगे बढ़ रहे हैं, हमें पता है कि द डार्क क्लाउड्स आर डिसअपियरिंग। यू ऑल हैव फॉट सो वेल बाय स्टेइंग होम एंड स्टेइंग सेफ फॉर योरसेल्फ एंड योर फैमिलीज. You worked very hard, and we look forward to getting a better deal when sunlight finally appears and we have erased this important virus. It's taking time for the society and for the authorities, but I think we should give them that time. This is one of the biggest challenges in modern world that we have faced. I face it 7 days a week, morning till midnight, and all my colleague urologists, doctors, nurses, healthcare personnel, they all face it non-stop. So we know what kind of situation we're going through. Thank you for a 5-minute salute and for your 9 minutes of lighting the lamp, which you did in 6 months ago. Time is just on a time warp. So while we balance ethics and we look at physical and mental health, today we are thinking out of the box completely to come to you and tell you that the challenge is huge, because the last 6 months, what I've seen is only complications and emergencies. And it's important for us to wake up. उस तरह की इमरजेंसी, उस तरह की कॉम्प्लिकेशन जो रूटीन चीजों को भूल जाने से होती है, हेल्थ बर्डन बढ़ता ही जा रहा है। बाकी हर डिजीज में, हर सब्जेक्ट में डिजीज में अगर बढ़ रहा है, तो प्रोस्टेट में भी उतना ही बढ़ रहा है। आज हम जब प्रोस्टेट हेल्थ की बात कर रहे हैं, ये हमारे जरूरी है कि इस अंग के बारे में अपने आप को आज अवगत कराएं, और अवगत कराने की जो कोशिश है वो इस ऑर्गन से रिलेटेड है। वो जो येलो कलर का ऑर्गन दिखता है आपको, जो बिल्कुल बीच पे है, उसे हम प्रोस्टेट कह रहे हैं, और यूरिनरी पैसेज आपको दिख रहा है कि प्रोस्टेट के बीच से आ रहा है। ये यूरिनरी पैसेज कभी भी ऑक्लूड हो सकता है, बिकॉज यूरिनरी पैसेज बहुत ही नैरो होता है। मैंने कभी भगवान से पूछा कि आपने यूरिनरी पैसेज इतना पतला क्यों बनाया और इंटेस्टाइन्स को इतना चौड़े क्यों बनाया, तो शायद हमको आंसर नहीं मिला। पूरी दुनिया बदल गई होती अगर यूरिनरी पैसेज उतना चौड़ा होता और मोशन की पैसेज या इंटेस्टाइन्स इतनी पतली, उतना खाने की जरूरत ही नहीं पड़ती, बिकॉज पेट जल्दी भर जाता. सो फूड फॉर थॉट दैट urinary passage of men and women is very narrow passage. And through that, when we exit urine in life, we know the computerized body is doing all well. Bladder contracts, the prostate or the passage opens and urine comes out. This entire change which can happen gradually in health, which could be related to infection or hormone change or just age-related change. So we're coming to that today. The prostate gland itself is a situation which is an enigma because it is an accessory sexual and a urinary gland. But the prostate conditions which come forward are sometimes life-threatening. It's important for therefore us to understand कि क्या साइंस और सिम्टम्स होते हैं जिससे मरीज डॉक्टर के पास जाता है, उसकी ट्रीटमेंट, उसकी प्रिवेंशन क्या हो सकती है, आज इनसे हम बड़े संक्षेप में समराइज करने की कोशिश करेंगे. सो प्रोस्टेट ग्लैंड एक वॉलनट शेप ग्लैंड है जो 15 से 18 से 20 ग्राम का होता है जब हम बहुत यंग होते हैं. उस 15 साल से लेकर के 35 साल की उम्र तक जो छोटी सी ग्लैंड है जो एक इन्वर्टेड कोन की तरह पड़ा हुआ है ब्लैडर के ठीक नीचे और रेक्टम के ठीक सामने, जिसके बीच से यूरिनरी पैसेज रन करती है और एक कंडुइट की तरह यूरिन को बाहर निकालती है. उसके कुछ सिक्रीशंस बेसिकली पुरुषों के हेल्थ के इंपॉर्टेंस की बात होती है और वो उस यंग एज में बहुत इंपॉर्टेंट होता है. तो प्रोस्टेट एक ऐसा ऑर्गन है जो बनाया ऐसे जगह पे है जो बिल्कुल जंक्शन पे है, वो बिल्कुल उस ट्रैफिक जंक्शन पे है जहां से यूरिन और सेक्सुअल पैसेज पुरुषों में मिलते हैं. तो एक तरह से ये ग्लैंड इतना अहम होता है बिकॉज ये अपने ही हार्मोन से कंट्रोल रहता है. वो प्रोस्टेट एबनॉर्मल कहा जाएगा जो प्रोस्टेट इन्फ्लेम होकर इन्फेक्ट होता है, जिसे हम एक शब्द में प्रोस्टेटाइटिस कहते हैं. तो यूरिनरी इन्फेक्शन के सारे जो उसूल होते हैं जिसमें यूरिन में जलन होना, यूरिन में दर्द होना, यूरिन में कभी ब्लीडिंग होना, फीवर होना और प्रोस्टेट में इसकी सीट बन जाना, इसे हम प्रोस्टेटाइटिस कहेंगे. लेकिन सबसे कॉमन प्रॉब्लम जो 40-50 से शुरू होती है जब हम बिल्कुल अपने आप को यंग और फिट समझते हैं और 60-70s के बाद वृद्धावस्था में 80s-90s में जो तंग कर जाती है, जिसे हम बेनाइन प्रोस्टेटिक हाइपोप्लेसिया या BPH कहते हैं, जो आज इस ऑडियंस में हर किसी को मालूम है, which is the commonest benign tumor in men. वो प्रोस्टेट की एनलार्जमेंट है जो हार्मोन के साथ चेंज होना ही होना. जैसे औरतों में मेनोपॉज होता है या एक समय पीरियड्स बंद हो जाते हैं, पुरुषों में इस तरह की हार्मोन चेंज और डेट नहीं होती. उनमें एक तरह की चेंज होती जाती है जिसमें कुछ लेथार्जी आता है, कुछ ऑर्गन्स कुछ बदलते हैं, कुछ एक्टिविटीज और कुछ कैपेबिलिटी बदलती है जो आज का संदर्भ नहीं है. लेकिन उनमें यूरिनरी सिस्टम बदलता जाता है. उनकी ब्लैडर शायद थोड़ी कमजोर हो रही जा रही होगी, शायद सब में नहीं पर कुछ लोगों में, पर उससे ज्यादा प्रोस्टेट अपनी हार्मोन चेंजेस के कारण 40s-50s से लेकर के 80s-90s तक जो चेंज लाता है, हम उस पर आज गौर करेंगे. हम अंत में प्रोस्टेट की जो ट्यूमर है जिसे हम कैंसर कहते हैं उसके बारे में भी गौर करेंगे क्योंकि वो ये अनूठा ट्यूमर है, अनूठा कैंसर है बिकॉज ये हार्मोन रिलेटेड कैंसर है. ये स्टमक कैंसर और ये लंग कैंसर की तरह नहीं है, इसका अलग ही बिल्कुल प्रकोप होता है और आपको इसके बारे में थोड़ी सी जानने की जरूरत है. तो हम आगे बढ़ने की कोशिश करके देखते हैं इस प्रोस्टेट ग्लैंड के बारे में जिसके बारे में बात कर रहा था. वो प्रोस्टेट ग्लैंड नॉर्मली एक छोटा सा ग्लैंड होता है. इतना एनिग्मा क्यों है इस प्रोस्टेट ग्लैंड में? बिकॉज बाकी हार्मोन बाकी ग्लैंड्स की तरह नहीं है, ये हार्मोन रिलेटेड ग्लैंड है और अब बहुत हद तक एक मिथ्या रही है कि प्रोस्टेट की साइज से बहुत कुछ फर्क पड़ता है. ऐसा सच नहीं है. मेरे मानने में और यूरोलॉजिस्ट के मानने में 20 ग्राम का प्रोस्टेट भी वो सब कुछ कर सकता है जो 200 ग्राम का प्रोस्टेट आपको तंग कर सकता है. तो प्रोस्टेट की साइज इतनी इंपॉर्टेंट क्यों नहीं होती? बिकॉज प्रोस्टेट की साइज जो हम मेजर करते हैं सोनोग्राफी में, वो दरअसल एक सोनोग्राफी की मेजरमेंट है. वो एक अल्ट्रासाउंड, एक ऑब्जर्वर ओरिएंटेड स्टडी होती है जिसमें हम उसकी साइज मेजर कर लेते हैं. बड़ा प्रोस्टेट अपनी अलग मुश्किलें लेके आता है, लेकिन कोई जरूरी नहीं कि बड़ा प्रोस्टेट यूरिनरी पैसेज को अंदर से ब्लॉक ही करे. बड़ा प्रोस्टेट साइज में बड़ा हो रहा होगा और शायद यूरिनरी पैसेज को उतना ब्लॉक नहीं कर रहा होगा और शायद इसीलिए आप डॉक्टर के पास नहीं गए क्योंकि प्रोस्टेट धीरे धीरे बढ़ रहा है. आपने जब जिस दिन सोनोग्राफी कराई वो एग्जीक्यूटिव हेल्थ चेकअप में या किसी कारण से पता चला आपकी प्रोस्टेट 90 ग्राम की है, 200 ग्राम की, लेकिन आपको उतना कंप्लेंस ही नहीं है और आपके भाई साहब हैं जो आपसे उम्र में डिफरेंट है और उनकी प्रोस्टेट सिर्फ 40 ग्राम की है, तो थोड़ी कम बढ़ी है आपसे, लेकिन उनकी मुश्किल ज्यादा है. So the problems which prostate brings about is because the urinary passage undergoes a change और उसके बारे में आज बात करते हैं. तो पहला और सबसे इंपॉर्टेंट चीज जो हम यंग लोगों के बारे में बात करेंगे, यंग एंड सेक्सुअली एक्टिव लोगों के बारे में बात करेंगे जिनमें यूरिनरी इन्फेक्शन हो सकता है if they don't maintain a great sexual hygiene, it's called inflammation of the prostate. itis वर्ड जब भी हम यूज करते हैं, appendicitis, tonsillitis, itis वर्ड नॉर्मली इन्फ्लेमेशन के लिए होता है. तो prostatitis is an inflammation or an infection of the prostate. और प्रोस्टेट बिल्कुल याद रखिए मधुमक्खी के छत्ते की तरह ग्लैंड है, अगर उसमें एक जगह इन्फेक्शन हुई तो पूरा प्रोस्टेट बिल्कुल इन्फेक्ट हो जाता है। इट्स लाइक अ हनीकॉम्ब, लाइक दैट काइंड ऑफ अ ग्लैंड। तो ये येलो वाला प्रोस्टेट जो बिल्कुल नॉर्मल लग रहा है, जिसके थ्रू यूरिन आराम से आ रहा था ऑन द लेफ्ट साइड, कहीं ना कहीं ये अगर इन्फ्लेमेशन होता है, इसमें इन्फेक्शन होता है, तो ये यूरिनरी पैसेज को स्क्वीज करेगा। कोई भी इन्फ्लेम्ड ऑर्गन हो, कोई भी इन्फ्लेमेशन हो जिसमें रेडनेस होती है, सूजन होती है, दर्द होता है, कोई भी इन्फ्लेमेशन में, उसमें प्रोस्टेट यूरिनरी पैसेज को संकुचित कर सकता है। तो एक यंग पेशेंट, मान लीजिए वो आपकी हमारी उम्र के 30s 40s 50s में, जिनको ये यूरिनरी इन्फेक्शन किसी कारणवश होता है, जिसमें यूरिन खाली नहीं हो रहा है, पोस्ट सेक्सुअल एक्टिविटी ये इन्फेक्शन हुई और ये इन्फेक्शन की प्रोस्टेट को इन्फेक्ट करता है। इससे होता क्या है, पहले ही ये पैसेज भगवान ने नैरो बनाया था, एंड थ्रू दैट नैरो पैसेज if there's an inflammation happening around, the prostate will get compressed, inflamed, at least temporarily, and there will be all those complaints about not being able to pass well, passing with difficulty, drop आना, जलन होना, दर्द होना, वगैरह वगैरह. So that could become a very difficult situation for many people. So young men who come for prostatic issues in their 20s, 30s, 40s, even 50s are men who come with prostatitis, which is an acute onset phenomenon. Fever हो रहा है, पेशाब में जलन हो रही है, दर्द हो रहा है, और यूरिन आ नहीं रहा, खुल के ड्रॉप आ रहा है और खून जा रहा है। अगर ऐसा कुछ किसी यंग आदमी में हो रहा है और पेन बिल्कुल पेल्विस में है, पेरिनियम में है, मोशन पैसेज और यूरिनरी पैसेज के आस कहीं डीप पेल्विस में है, तो उसको भी ये प्रोस्टेटाइटिस है। ये उस तरह की इन्फ्लेमेशन है जिसमें मेडिकल हेल्प की जरूरत बहुत जल्दी पड़ती है। ये डायबिटिक लोगों में ज्यादा प्रकोप रखता है और डायबिटिक लोगों में इसकी हीलिंग पावर्स कम होती है। डायबिटिक लोग ऐसे भी कम हील करते हैं, पॉसिबिलिटी है कि ऐसे कंडीशन में इन्फेक्शन और भी हमें कम कर सकते हैं। So prostatitis is a disease more of young men, but can happen also in elderly. Prostatitis is more of an inflammation or infection of the urinary gland, and something which could be a situation which is an acute onset, sudden onset phenomenon. ये सालों साल नहीं चल रहा है। हम एक शब्द यूज तो करते हैं जिसे कहते हैं chronic prostatitis। जो chronic है वो कई सालों से चल रहा है और हम डॉक्टर को दिखाए जा रहे हैं, हमें वो आराम नहीं मिल रहा है। लेकिन जहां तक acute prostatitis है, जो बिल्कुल फीवर, बर्निंग, पेन, ब्लीडिंग, नॉट एबल टू पास यूरिन, इन सब चीजों से सिस्टमिक सिम्टम्स से आता है, इसकी तैयारी, इसकी ट्रीटमेंट बिल्कुल इंजेक्टेबल एंटीबायोटिक से होती है। बहुत बार आपके डॉक्टर आपको एडमिट करते हैं, इंजेक्टेबल एंटीबायोटिक्स देते हैं। यूरिन खुल के नहीं आ रहा, ज्यादा यूरिन रह गया तो टेम्परेरी एक यूरिनरी कैथेटर की जरूरत होती है, क्योंकि वो इन्फेक्टेड यूरिन को ड्रेन करना होता है। प्रोस्टेटाइटिस अनफॉर्चुनेटली इज अ डिजीज ऑफ इन्फेक्शन एंड इन्फ्लेमेशन, कैन अफेक्ट एनी एज ग्रुप एंड ऑल एज ग्रुप बियॉन्ड एडोलेसेंस। वो छोटे बच्चों में इसलिए नहीं होता बिकॉज अभी प्रोस्टेट डेवलप हो रहा होता है, दूसरा, और उनमें कोई यूरेथ्रल इंस्ट्रूमेंटेशन नहीं, उनमें कोई यूरिनरी इंस्ट्रूमेंटेशन नहीं है, वो सेक्सुअली एक्टिव नहीं है, उनमें इन्फेक्शन के चांसेस कम है, अनलेस कुछ इनबिल्ट कंजेनाइटल या डेवलपमेंटल एनोमली है जो हमें दिख नहीं रहा, जिसकी टेस्ट लगती है। सो प्रोस्टेटाइटिस इज अ डिजीज ऑफ मेन ऑफ एक्यूट सीवियर इन्फेक्शन। हम इस पे गौर करना चाहते हैं जिसे कहते हैं प्रोस्टेटिक एनलार्जमेंट, और ये हम सब में हो रहा है। जैसे हमारे काले बाल धीरे धीरे सफेद होते जा रहे हैं और हमें एक भी दिखता नहीं है। हर दिन हम सुबह बालों को बिल्कुल संवार के आते हैं काम करने, लेकिन हमें नहीं दिखता कि हमारे बाल धीरे धीरे सफेद हो रहे हैं। सिमिलरली प्रोस्टेट तो बहुत अंदर छिपा हुआ है, वो जो यूरोलॉजिस्ट ही अपनी उंगली से जांच कर सकता है। तो प्रोस्टेट की एनलार्जमेंट, जिसको हम बीपीएच कहते हैं, बेनाइन प्रोस्टेटिक हाइपरप्लेसिया, वो इनविजिबली आपके बॉडी में चेंज हो रहा है और आपको दिखेगा। आपको शायद सोनोग्राफी में प्रोस्टेट की साइज दिख जाएगी, पर मेरा साइज से इतना इंटरेस्ट आज नहीं है। क्यों? बिकॉज साइज बढ़ रही है इसलिए बिकॉज आप कंप्लेन नहीं कर रहे हैं। आग लग रही है और धुआं निकल रहा है बिकॉज आप कंप्लेन नहीं कर रहे हैं। तो दरअसल चेंजेस बहुत स्लो हो रहे हैं और आपको मुश्किल नहीं दे रही है। मुश्किल हो रही है लेकिन क्योंकि बॉडी इतनी केपेबल कंप्यूटर है कि वो अपने आप को एडजस्ट करती जा रही है। Symptoms of gradual change in blockage of urinary passage, which happens very gradually over months, years, and actually and frankly over decades, is something which men complain and they don't remember from time immemorial कब से urinary problem हो रही थी. So it's very important for us to wake up every man in the society and every man in the audience, which could be in his 40s, 50s, 60s, and even 80s and 90s. Important for us to, it's a wake up call. Prostate is undergoing a change. So just for the sake of example, that is a prostate through which urine will pass easily. When the bladder contracts, the passage open, urine comes up. As simple as that. But out here, what happens? The prostate is gradually enlarging. And as it enlarges, it actually tries to block the urinary passage gradually and completely. So prostate की awareness कितनी important है, because ये organ आपकी अनुमति के बिना और आपको बिना बताए उस तरह की changes ले रहा है जो आपके hormone की changes के साथ साथ हो रही है. So while you continue to do your best in life, when you get most established in your 40s and 50s, look at your work, your family, look at the entire aspect of taking the burden of your own responsibility across. There's an organ which is undergoing a change, and that change is something which is possibly going to take all men, all of us in our lifetime. It's very important for us to know. Sadly, we have not seen old age. We haven't seen old age yet. जो आज 70 का है उसने 80 नहीं देखा, जिसने जो आज 90 का उसने 100 उम्र नहीं देखी है. तो 10 साल बाद क्या होने वाला है is all that can be known only when you complain, or if you realize, or you wake up, or you do a health checkup, or finally if you see a urologist. So it's very important for us to wake up to a change which is happening around. मिसाल के तौर पे एक example देता हूँ. We come down from a flight and we go to a washroom before we pick up our luggage and then take a taxi and go to our destination in any city. It could be Bombay, Delhi, Kolkata, Madras, Chennai, or Frankfurt or Miami. When we look at that aspect of reaching the toilet of an airport, we are full bladder. We want to empty our bladder before we get into the busy traffics of Sao Paulo and La Paz. What are we interested in? We want to empty the bladder. You will find some people take a long time to empty urine. Some people empty the urine very quickly. It also happens in our office toilets where two people reach together. One takes a long time, one takes a very long time. So इससे क्या बात चलता है कि ब्लैडर की जो कंप्रेशन की पावर है या रास्ते की खुलने की चीज है, इन दोनों में कुछ ना कुछ चेंज हो रहा है, और इस चेंज के बारे में अवगत होना जरूरी है, क्योंकि ये बहुत ग्रेजुअली हो रहा है और ये हर दिन की मिसाल है, हर दिन का रूटीन है, इसलिए लोग इसमें ढल जाते हैं. लोगों से पूछते हैं कि आपका पेशाब खुल के नहीं आता. सर वो तो बहुत सालों से नहीं आ रहा, तो कर क्या रहे थे घर में? आपने अपने डॉक्टर को पहले कंप्लेन क्यों नहीं किया? इस कोविड टाइम्स में हमारे हॉस्पिटल में, हमारी क्लिनिक में हम 3 यूरोलॉजिस्ट और ऐसे कई हॉस्पिटल्स में यूरोलॉजिस्ट रात को देखते हैं कि 2, 4, 5 मरीज लोग जो बुजुर्ग हैं, जिनको और बहुत सी अलग कोमोबिड फैक्टर्स है, डायबिटीज, हाइपरटेंशन, हार्ट की डिजीज, पार्किंसंस, उनकी यूरिन बंद हो गई, वो कॉन्स्टिपेटेड है, और आते हैं और उनकी यूरिन के रास्ते एक पाइप लगाया जाता है जिसे कैथेटर कही जाती है. एंड व्हेन यू प्लेस अ कैथेटर, a patient in acute retention comes with urine which actually is anything between 500 ml to 1 liter of urine in the blood. तो एक ही दिन में आप इतना यूरिन रोक नहीं सकते. या तो आपकी आदत हो गई है धीरे धीरे इस तरह से ब्लैडर को फुलाते जाना, या फिर ऐसा कुछ सिचुएशन हुआ है जिसमें there is an acute retention because the passage was gradually choking till you actually walked and finally one day you reached the edge. It could be only compounded by an infection which even causes trouble in young age called prostatitis. It could be compounded by a severe constipation which elderly people suffer. It could also be compounded by a weak bladder gradually weakening as a result of diabetes mellitus which is uncontrolled or long standing. तो देखिए हमारे पास कितने दुश्मन है. ये दुश्मन अलग अलग रास्ते से आने की कोशिश कर रहे हैं और तंग करने की कोशिश कर रहे हैं. इसमें बेचारा प्रोस्टेट अपना चेंजेस कर रहा है, लेकिन पीछे से कॉन्स्टिपेशन तंग कर सकता है, ऊपर से कमजोर ब्लैडर पुश न करे या कोई इन्फेक्शन आकर के प्रोस्टेट को और इन्फ्लेम कर दे, तो एक बॉर्डर लाइन प्रोस्टेट बेचारा ब्लॉकेज में जा सकता है. So symptoms of difficult urination tend to increase with age. Gradually, the symptoms increase and they can sometimes be troublesome. Let's move forward. There is a disease called prostate cancer. Now, unlike all other cancers, which could be an oral cancer, which is again because of beetle chewing and various kinds of other issues, a stomach cancer, a kidney tumor, it could be a lung cancer, are these different kind of cancers around. They have different kind of insults happening around. But a prostate cancer, sadly, is a cancer of men with aging. अगर मैं आपको बोलूं कि at the age of 80 years, 80% people have gray hairs, you will believe me and clap. But if I tell you that at the age of 80 years, 80% people have got a cancer prostate sitting inside their body, you may not believe. But that's true. At the age of 80 years, 80% people across the world will have a cancer prostate sitting inside. But at that point in time, they are not bothered. The doctor may not be bothered. And there may be no major symptoms, which means it could be an incidental tumor. So till the age of 80, we have to do well to be able to have something inside which possibly will not trouble us. But that journey, which starts from the age group of 45, 55 to 65 to 85, is an important age where we need to wake up to this phenomenon called prostate cancer. And this is a very important phenomenon. So we'll come to that. We'll come to discuss this around because this is a hormone-related tumor. And the entire intention today is to just wake you up that ये ऐसी ट्यूमर है जिसको एक डॉक्टर ट्रीट कर सकता है और क्योर कर सकता है. ये क्योरेबल है बिकॉज ये अलग तरह का ट्यूमर है, इसको हम हार्मोन से मैनिपुलेट करते हैं. तो इसकी मैनिपुलेशन बहुत ही अजीब तरीके से होती है और जिसपे हम आगे बढ़ते हैं. लेट अस कम बैक टू बीपीएच, जो बहुत ही इंपॉर्टेंट टॉपिक है. ऑब्स्ट्रक्शन टू द फ्लो ऑफ यूरिन, बिकॉज यूरिनरी पैसेज ब्लॉक हो रहा है बिकॉज द प्रोस्टेट इज अ ट्रैप डोर and it actually traps the urinary passage. What could happen is this. What could happen is the urine was flowing very well in younger age group and you could almost pass urine to the wall and beyond the border. But right now, because of the blockage that is happening around, that is a urinary pipe which is absolutely open. And that will be compressed by the prostate internally. And that is where our entire intention is. So prostatic size could be 20 or 200 grams. if the urinary passage is getting blocked even at a small prostate, you will continue to have symptoms for which you may possibly not believe, or you may rest yourself and say, "Mera prostate to chota hi hai. I am very much aware, and my doctor has told me that it's a small prostate." So let's not go into the myth about a small or a big prostate, but let's get into the reality about what are my complaints, what are my symptoms. And no two patients are same, number one. Number two, I am not the same person what I was in 2019 and 2020, what I'll be in 2022 and 2024. There is a gradual progressive change happening around. So BPH patients complain about obstruction. That's a primary complaint. They may not be able to decipher. They are very literate people. The most literate people do come and see us across the country and the world. They see urologists. But possibly, as I said in the very beginning of the talk today, they always come late. It's not easy to identify. जो चेहरे पे होता है वो तो हम अनदेखा कर देते हैं, कभी क्रीम लगा लेते हैं. तो जो अंदर इतना डीप हो रहा है और जो इतना ग्रेजुअल हो रहा है, उसको पकड़ पाना हर समय पॉसिबल शायद ना हो. बहुत इंपॉर्टेंट. होता क्या है? Enlargement of the prostate gland comes with what phenomena is what I need to tell you. ये हमने आपको दिखाया था. ये एक prostate gland का लोब है और एक prostate gland का लोब है. This is a cut section of the urinary passage, and the prostate can actually enlarge and go inside the urinary bladder and can also cause blockage internally here. Have a look at this. There is a prostate which is causing a blockage in the urinary passage here. There is a prostate which is causing a blockage here or going all the way inside the bladder. The prostate is like a door. Imagine this is a room where I'm seated and that's a door. I walk and the door opens and I reach outside. Imagine if the door is closed. What will I do? I'll continue to knock, knock, knock. I'll continue to knock till the door opens around. And by knocking the door may sometimes not open. Somebody has to open the door. So the prostate is a door and the bladder is the room. So the room contracts and the door opens and urine comes out. What happens if the bladder does not contract? If I don't get up, I will never reach outside. If the door does not open, I will never reach outside. So both things help me to reach outside. My walking and my coordination with the door. So bladder contracting and its coordination with the prostate as an outlet, which may undergo an outlet obstruction, as I've shown you with various pictures in various kinds of enlargement, which is more of a medical connotation. But the door closing gradually from 40s to 50s is not picked up by many people till they do a health checkup and they look at that the prostate is enlarged. And when the prostate is enlarged, the medical officer sends them to me and says that, please go and see Dr. Pandey. So when they come in here, I say prostate enlargement is fine. But do you have any complaints? And they say we have no complaints. And then we investigate and look at the complaints that they have are not yet visible to them too. That means an awareness drive of the kind which I do every day in the outpatient department morning till evening is what is important. So the obstructive symptoms, because the prostate is trying to compress by the red arrows in the urinary passage. Number one is hesitancy. Taking time to start urine. Urine pass करने की तो बात दूर है. जब जाते हैं और तैयार होते हैं और ब्लैडर बिल्कुल सेंसेट है, तब यूरिन शुरू करने में टाइम लगती है. Decrease force and caliber of stream. जो यूरिन का पास करते हैं, उसकी धार बहुत पतली आती है. ये धार 10 साल पहले बहुत जोरदार थी. जब हम अपने दोस्तों के साथ यूरिन पास करते थे और बिल्कुल दीवार तक पास कर पाते थे. We could paint on the wall. आज वो हो नहीं पाता. आज पाँव के आसपास गिर रहा है. After I complete urination, maybe I want to pass more, but the urine doesn't come out completely. That means incomplete voiding, पूरा खाली नहीं होता है. और उसके लिए क्या करता हूँ मैं? I strain to pass urine. जोर लगा के पेशाब करना पड़ता है because bladder अकेले काम नहीं कर पा रहा क्योंकि इतना ज्यादा compression है. Bladder के साथ साथ पेट को भी push करना पड़ता है. और करने के बाद end में there could be a post void dribble or there could be a situation where the urine would actually be coming in the end drop. So there's a huge possibility of this kind of phenomena happening to men, where men don't believe it. It's something which happens, and obviously because it's so slow, difficult to understand. Remember, people may have one or more than one complaint. कुछ लोग बोलते हैं साहब मेरे को शुरू करने में मुश्किल होती है, शुरू करने के बाद सब कुछ सही हो जाता है. कुछ लोग बोलते हैं कि मेरी धार शुरू से अंत तक बहुत पतली. कुछ लोग बोलते हैं कि पता नहीं हमने जैसे भी पास किया लेकिन हम खाली नहीं कर पाते. And when they complain of that level, it's already too late. By the time you have a chest pain, it's already too late. That means either you need angiography to understand whether you need angioplasty or a bypass. So it's important for us to understand that by the time we have a chest pain, by the time we have a complete blockage, it is always too late. Your urologist will be forced to then not only treat and reverse, but he'll have to bring about curative designs into the whole thing. So it's important to understand obstructive symptoms are the primary symptoms, जिस symptoms के द्वारा prostate की complaint होती है. पुरुष ये complain करते हैं. They complain in combination or they complain separately. अब मैंने बताया दरवाजा बंद हो रहा है. दरवाजा बंद हो रहा है तो obstruction हो रहा है. How does it translate into the change which a bladder could suffer around. And let me just annotate some pictures to show you. मैंने आपको बताया था कि prostate यहाँ पे है, तो ये रही prostate, और prostate में blockage हो रहा है और urine खुल के नहीं आ रहा है. As a result of which the urinary bladder is suffering. You can see the urinary bladder suffering. Bladder अब बिल्कुल normal किस्म का bladder नहीं रहा. Bladder is actually weakening up, उसमें diverticulae form हो रहे हैं और ये सफेद सफेद जो diverticulae हो रहे हैं, bladder की outpouching हो रही है. अब bladder बिल्कुल कमजोर होता जा रहा है because गुब्बारा बहुत देर तक फूला रहता है, खाली नहीं कर पाता. उसकी पूरी capability about sensing the urinary system, being able to inflate and deflate is actually going for a toss. As a result, इस bladder के ऊपर भी कुछ organs हैं, उनको चोट पहुंचती है. आप देखेंगे कि urinary pipes जो हैं, उनमें सूजन होती जा रही है. I'm still annotating the left side. किडनी की पाइप से उनमें तक प्रेशर जा रहा है और किडनी एक तरह से सफर कर रहा है. अगर हम राइट साइड की ट्यूब में जाते हैं तो देखते हैं किडनी में भी सूजन होनी शुरू हो गई है. दोनों किडनी में सूजन हो रही है और ब्लैडर बिल्कुल भरा पड़ा है. ऐसे लोग कब आते हैं? ऐसे लोग बहुत देर से आते हैं. हमारे पास कुछ मरीज हैं जिनको हमने आज देखा और हमने कल ट्रीटमेंट शुरू की और उसके बाद शायद हमने 1 महीने बाद 3 महीने बाद बुलाया कुछ और इवैल्यूएशन के. वो शायद 1 महीने 3 महीने 1 साल 2 साल तक आए नहीं, और जब आए तो उनका ब्लैडर बिल्कुल प्रेग्नेंट था, बड़ा सा पैल्पेबल और विजिबल ब्लैडर था, बिल्कुल ब्लैडर भरा हुआ है. तो अगर ब्लैडर भरा हुआ है तो प्रेशर ऊपर की तरफ जा रहा है जो किडनीज को कंप्रेस कर रहा है. ऐसे लोगों को साइलेंट किडनी फेलियर हो सकता है. तो बहुत इंपॉर्टेंट है कि अगर आपकी किडनी में बहुत सूजन है, जो नॉर्मली पत्थर के कारण होता है, रुकावट के कारण होता है, और आपकी ब्लैडर भी बहुत भरी हुई है, मतलब प्रेशर बिल्कुल यहाँ से पीछे की तरफ जाता जा रहा है, वो प्रोस्टेट की ब्लॉकेज ब्लैडर को कंप्रेस कर रहा है, ब्लैडर बिल्कुल फूलता जा रहा है गुब्बारे की तरह. एक समय के बाद the bladder cannot take its pressure and the pressure is transmitted all the way up to the kidneys, and that's a sad story. So it can be an acute phenomena which can happen suddenly over few hours to a day or two, or it could be gradually happening over days, months and even years. कुछ लोग आते हैं जहां आपने गुब्बारे को इतना फुला दिया कि फिर आप उसको रिवर्स नहीं कर सकते, उस ब्लैडर की फिर इलास्टिसिटी खत्म हो जाती है. So the more you stretch your bladder, more you postpone urination because you are on the Western Express Highway, because you're in locations where you can't find a toilet. Which sadly sometimes women do because they don't get the right toilet around. They go through an agony. It's very important for us to wake up to this. क्योंकि ये ब्लैडर सफर कर रहा है. कौन सफर कर रहा है? ब्लैडर सफर कर रहा है. प्रोस्टेट तो एक नैरो पैसेज को डील करता था और वो कंप्रेस होता गया. जो ब्लैडर सफर कर रहा है या ब्लैडर इरिटेट हो रहा है, उससे होता क्या है? So as the bladder gets irritated, the bladder learns a behavior. It's a protective or a defensive behavior which the urinary bladder learns. And what are the behaviors? Again, it's so slow till you understand all that. The bladder learns a way of contracting. Sadly, it may not be an effective single contraction which happens when you are in good health and when you are younger, but the bladder contraction sadly is going down. It is sadly getting decompensated. It is getting irritated. And that urinary bladder, which had a mind of its own, is now forced to act. It has to act, and it contracts erratically. And therefore, it gives you a frequency, it gives you a sensation. Therefore, a lot of men complain, मेरे को दिन में बार-बार जाना पड़ता है, मैं कंट्रोल नहीं कर सकता, कपड़े गीले हो जाते हैं. There's an urgency which is a compelling desire where they cannot control urine. Sometimes they would leak urine at odd times in odd places, and therefore they don't drink water. They stop their car wherever they want to because they are not able to control around. The urinary flow becomes intermittent. यहाँ रास्ते में रुकावट हो रही है और यहाँ ब्लैडर यूं कॉन्ट्रैक्ट कर रहा है. तो ये दोनों की जो एंड रिजल्ट होती है, the urine cannot come out well. Very important for us to understand that. We will have to take complete control of that. रातों को पेशाब बार बार होती है जिस पे हम गौर करेंगे, और यूरिन में जलन होती है. कभी कभी यूरिन में इन्फेक्शन हो सकता है बिकॉज ब्लैडर कभी खाली नहीं हो पा रहा है. तो देखते हैं आप किस तरह के पुरुष यूरिन पास कर रहे हैं, किस तरह की सिचुएशन हो रही है. इंटरप्टेड स्ट्रीम, पासिंग विथ हेजिटेंसी, नॉट एबल टू स्टार्ट, straining and pushing urine out like it happens in constipation, terminal dribbling, passing in drops. There's an urgent need. If you can't search a toilet, you leak urine, all that sad things around. Silently, with all that is happening and which is visible to you, many people still postpone urination, which is not a good idea. Number one. Number two, ये सब कुछ तो आपको दिखता है, जो आपको नहीं दिखता उसमें आपका ब्लैडर सफर कर रहा है. जो आपको नहीं दिखता उससे भी ज्यादा इंपॉर्टेंट है कि there is a possibility that your kidneys may be suffering slowly. So I need to understand and inform every man on earth today from a platform which Dr. Reddy's, thank you so much. I come and thank you now when the audience is all ready and probably soaked in the subject. Dr. Reddy's, thank you so much for taking this initiative in September month, the month of prostate awareness, where we need to reach the society. So I need to come out of this building, though I'm still seated on the second floor Department of Urology. I and my colleagues, Dr. Bijoy and Dr. Ismail, who work as a team in this team. And we have got wonderful colleagues who actually run the show as Men in Blue, the students and the medical officers. and then the entire hospital which rallies around us helps each department to take it to the highest possible level. The centers of excellence in the Kokilabein Dhirubhai Ambani Hospital in Mumbai. It is important for us to listen to the sound of music, the sound of music of the prostate and the bladder. If we don't listen to the sound of music which the bladder and the prostate are creating in terms of the trouble which is gradually happening, then we actually come late. And that's why I always said treatment delayed is treatment lost kind of situation. So let's go to that. Let's go to understand that the prostate is enlarging or prostate is not enlarging but causing an internal blockage. Let's understand that the urinary blockage which can happen even with a small prostate, not necessarily always with a big prostate. Let's also understand that the prostate undergoes these changes, the room or the bladder will suffer more, and that suffering is very silent for a very long time. Sometimes it could actually put pressures to the kidney and the kidney can even fail. So for you, if there's a urinary complaint of any kind, which is all about burning sensation, passing blood in urine, difficulty in passing urine, passing very frequently, I think you should wake up to the very important opportunity of not missing out to see a urologist. In your city, wherever you live in, whichever location you live in, Mumbai, right from Dharavi, Dombivli to Valsad and going beyond that to Gujarat and all this time to South Mumbai. There are my colleagues in urology, and I bring greetings from Mumbai Urology Society and my colleagues from all across Mumbai who do this work for you. They would always be willing to take you in your routine hours. Creating an emergency out of it will be a troublesome thing, is what we will come to next. So let's move forward. The other symptoms are possibly the symptoms that you don't want. What you don't want is a burning sensation in urine. पेशाब में अगर जलन होना मतलब कोई इन्फेक्शन है, यूरिनरी इन्फेक्शन है, जो कभी कभी यूरिनरी पैसेज से ऊपर तक जा सकता है और आपकी यूरिनरी ब्लैडर को इन्फेक्ट करता है, जिसको हम सिस्टाइटिस कहते हैं, या किडनीज को इन्फेक्ट कर सकता है, जिसे हम पाइलोनेफ्राइटिस कहते हैं. Bleeding in urine is never normal. Bleeding in urine is never normal, and it's not because of summer season. Let's tell you that. Bleeding in urine is never normal, and it's not because you drink less water. So bleeding in urine is because of a pathology or because of a disease. क्या क्या हो सकता है bleeding in urine? बहुत सीवियर इन्फेक्शन के कारण ब्लीडिंग हो सकता है, जिसे हम हेमेचूरिया कहते हैं. बहुत ही प्रोस्टेट बहुत ही बड़ा हुआ है और प्रोस्टेट की एक ब्लड सप्लाई होती है जिसके कारण ब्लीडिंग हो सकता है. आप बहुत स्ट्रेन कर रहे हैं, या आप एक कार्डियक पेशेंट हैं जो ब्लड थिनर्स पे हैं और आपकी प्रोस्टेट बढ़ी हुई है, या एक सीवियर इन्फेक्शन हुई है, या फिर कोई स्टोन है जो किडनी और किडनी के पाइप से उतर रहा है, जो आपको साइड में दर्द हो रहा है, जिसके लिए हम यूरेट्रिक ट्रीटमेंट करते हैं, या फिर कोई स्टोन यूरिनरी ब्लैडर में होगा. सो हेमेचूरिया, हेम इज ब्लड एंड यूरिया इज यूरिन. सो हेमेचूरिया इज ब्लीडिंग इन यूरिन, जैसे हेमाटोस्पर्मिया होता है, ब्लीडिंग इन सेमेन. सो ब्लीडिंग इन यूरिन इज नेवर नॉर्मल. And if that's happening, please see your doctor, please see your family doctor, your urologist, please see somebody. Very important. Painful urination, not able to pass, passing in drops, passing and stopping. Ineffective passage of urine. That sadly is a culmination or the edge. Severe infection or severe obstruction. That's called strangury. Strangury is a very difficult term, not a very easy term around. We need to know that. And finally, pain in the lower abdomen. Lower abdomen or the lower tummy is where the urinary bladder is housed. You know where the urinary bladder is. And suddenly there could be a sensations around. So it's very important for us to wake up to this. Very, very important that we don't let complications happen around. What are the investigations which a doctor does? और ये आपके लिए जरूरी है कि आप अपने आप ही अपना टेस्ट करके ना आए. अगर आपको मुश्किल है तो अपने डॉक्टर के पास जाएं. हर डॉक्टर एक बहुत ही फोकस टेस्ट करना चाहता है. आप मेरे पास आएंगे तो मैं ब्रेन की एमआरआई और हार्ट की टेस्ट नहीं करूंगा. मेरा बिल्कुल फोकस रहेगा आपकी प्रोस्टेट इश्यूज पे इस सितंबर के महीने में. तो हम यूरिनरी टेस्ट करने को बोलते हैं, और ये जानना बहुत जरूरी होगा कि यूरिन का जो सैंपल हम बॉटल में देते हैं वो कोई जरूरी नहीं है कि सुबह का सैंपल हो. पहला तो आइडियली यूरिन सुबह का सैंपल सही होगा, लेकिन कोई जरूरी नहीं है. अगर आप मेरे से 10 बजे और 12 बजे सुबह मिले तो उसके बाद अगला काम आपका यूरिन का सैंपल देना होगा. पुरुषों में यूरिन सैंपल देने की एक बहुत ही इंपॉर्टेंट प्रथा है जो सबको पता होना चाहिए. अ यूरिन सैंपल शुड ऑलवेज बी अ मिड स्ट्रीम एंड अ क्लीन कैच स्पेसिमेन. अ मिड स्ट्रीम एंड अ क्लीन कैच स्पेसिमेन मतलब बीच का पेशाब और बिल्कुल कोई कंटामिनेशन के बिना. नॉन सर्कमसाइज्ड मेन, नॉन सर्कमसाइज्ड बिकॉज ऑफ रिलीजन, नॉन सर्कमसाइज्ड बिकॉज अदरवाइज डिड नॉट रिक्वायर, वो लोग हैं जिनकी प्रेप्यूस या स्किन उनको कवर कर रही हो जिसमें कंटामिनेशन रहता है. पुरुष बहुत बार उसको उस तरह से क्लीन नहीं रख पाते जैसा हम डिमांड करते हैं, उसमें हर समय कंटामिनेशन रहता है. उस कंटामिनेशन को अगर आपने डायरेक्टली बॉटल में दे दिया तो आपके डॉक्टर आपकी रिपोर्ट की ट्रीटमेंट कर रहे हैं, आपकी बीमारी की ट्रीटमेंट शायद कम कर रहे हैं. So it's very important for us to give the right sample. So whenever you give a urine sample, please remember that in a male, you would retract your prepuce, wash it up very well. Your bladder is full. You start passing urine. The first part of urine does not go to the bottle. It's only the middle part of urine which goes to the bottle without touching the bottle. So you're touching nothing. The urinary stream which comes does not touch the prepuce. It's already very cleaned up, everything. It does not touch the bottle. It's always a midstream and a clean catch, ideally in the morning, but it should be very close to the time you deliver to the lab. The culture test is basically to rule out an infection. The area is contaminated everywhere. आपके मुंह में, नाक में, सब जगह बैक्टीरिया है. हम उनकी कल्चर कभी करते ही नहीं, हमें जरूरत ही नहीं पड़ी. उस ऑर्गन की कल्चर क्यों करते हैं? बिकॉज यूरिनरी पैसेज में नॉर्मली कोई बैक्टीरिया नहीं होते. यूरिनरी पैसेज में नॉर्मली कोई बैक्टीरिया नहीं होते, और उसको अगर हम कल्चर करने की कोशिश करें तो जानने की कोशिश कर रहे हैं कि मरीज की जो प्रॉब्लम है, मरीज की प्रॉब्लम क्या है. यूरिनरी बर्निंग सेंसेशन, इन्फेक्शन, दर्द होना, स्ट्रैंगरी होना, हेमेचूरिया होना किसी इन्फेक्शन के कारण है क्या, और उस इन्फेक्शन को अंदर में जो सीट हो गया है उसे जानने की जरूरत है. एंड देयरफॉर वी आस्क फॉर द राइट सैंपल. सो कल्चर्स विल टेल अस द काइंड ऑफ बैक्टीरिया which has invaded from across the border. They were shooting across the border. Now they've infiltrated into our perimeter, into our map of our country. So it's important for us to understand that urinary system has got no bacteria inside. A bacteria goes in, it actually would attach somewhere by its feet or papillae, and it will grow into multiple things. Therefore, your urologist gets to see 10 to the power 5 उनकी रिपोर्ट, और उसके बाद क्या एंटीबायोटिक कल्चर. सैडली क्योंकि मरीजों ने सही सैंपल दिया नहीं, क्योंकि अवेयरनेस थी नहीं, और मरीजों ने क्योंकि सही सैंपल दिया नहीं, यूरिन की कल्चर की ट्रीटमेंट इस तरह से होती है जो बहुत ही सैड प्रथा है. सो आप अब जाने कि अगर आपके डॉक्टर इतने व्यस्त हैं, उन्हें शायद बताया नहीं कि यूरिन का सैंपल कैसे देना है. इट्स ऑलवेज अ यूरिन मिड स्ट्रीम एंड अ क्लीन कैच स्पेसिमेन व्हिच इज टू बी गिवन वेरी क्लोज टू द टाइम ऑफ seeding of it in the hospital. So give it in the hospital itself, give it in a lab itself rather than carrying too much from home. Ultrasonography is an observer oriented investigation. अंदर में जो चेंजेस हो रही हैं उनकी स्टैटिक चेंजेस को एक सोनोलॉजिस्ट जो एक बहुत ही रेस्पेक्टेड डॉक्टर हैं, जो हमारे टीम के बहुत बड़े अंग होते हैं, वो इसे पकड़ लेते हैं. So radiology is a very important benchmark, and let me salute all the doctors who are not in the front of you. In the front of you are clinicians, पर याद रखिएगा microbiologist, pathologist, radiologist, जितने भी लोग हैं, anesthetist, they happen to be very important doctors in the entire fraternity because they take care of those invisible things which actually help us to move forward. So जितने लोग पर्दे के पीछे हैं वो लोग उतना ही काम करते हैं और उससे ज्यादा काम करते हैं to safeguard your health. So अल्ट्रासोनोग्राफी आपके प्रोस्टेट की साइज बताती है. प्रोस्टेट ब्लैडर के अंदर तो नहीं बढ़ रहा है. यूरिन पास करने के बाद कितना बच जाता है, ब्लैडर की थिकनेस कितनी है, ब्लैडर में कोई स्टोन्स और डेब्री तो नहीं है, किडनी पे चोट तो नहीं पहुंच रही है, किडनी में वो सूजन तो नहीं हो रही है, आप बहुत देर से तो नहीं आए, वगैरह वगैरह. एंड फाइनली a urologist like me would ask you for a test called uroflowmetry. Metry is measurement, flow is speed, and uro is urine. So I think I've nipped at everything in the bud when I say uroflowmetry. Metry is measurement, flow is speed, and uro is urine. That is what the naughty prostate is doing to you. It is trying to cut down the flow of urine. And we want to know at which station are you in. अभी आप कौन से स्टेशन पे हैं आज के दिन, आपकी प्रोस्टेट आपको कौन से स्टेशन पे ले आई है, ये कहाँ आ गए हम यूं ही चलते चलते. So is the prostate hardening you and giving you a good flow, which is called a bell-shaped curve, or the flow is gradually getting poor? And finally, for all men beyond 50, we do the test called serum PSA. PSA is a prostate-specific antigen, a kind of a marker which is produced from the organ called prostate. It is not a disease-specific marker. Let me tell you very clearly. It's an organ-specific marker. That means the organ which is prostate, it secretes an antigen, which when very high will be spilled in the blood, and therefore we do a blood test and pick it up. Acute prostatitis, मतलब prostate की infection है जो अब तक आप अच्छे से जान चुके हैं. Acute prostatitis is a very serious kind of an infection. उसमें PSA की level करीब 50, 100, 200, 400 भी जा सकती है. And sadly, you will be worried, googling around and thinking that it's a prostate cancer, which is not true. So in an acute setup, मैं आपको बताना चाहता हूँ, जब हमारे emergency department जो हमारा पहला front line है, जो शाम को 7-8 बजे से अगले सुबह 6-7 बजे तक जो फ्रंट लाइनर्स हैं, जो डॉक्टर्स हैं, जो इमरजेंसी डिपार्टमेंट हमारा संभालते हैं और सारे हॉस्पिटल में, दे आर द वंस व्हेन दे सी यू फॉर अ प्रोस्टेट इशू, दे ऑलमोस्ट सी यू दैट योर यूरिन इज ब्लॉक्ड, सैडली यू हैव कम लेट, दे पुट अ कैथेटर, दे डू ऑल द टेस्ट, बट दे डोंट वांट टू डू अ पीएसए. पीएसए इतनी एक्यूट सेटअप पे करने की कोई जरूरत नहीं है, बिकॉज एक एक्यूट सिनेरियो में, एक एक्यूट इन्फेक्शन में, एक एक्यूट रोटेशन में पीएसए बहुत बड़ा होता है. और मैं आज ये मिथ को यही शैटर करना चाहता हूँ कि PSA is not a real marker for prostate cancer. The real marker for prostate cancer is a prostate biopsy. Finally, you have to prove whether there's a prostate cancer or not. इस शहर में जहाँ हम रहते हैं वहाँ ऐसे 10,000 लोग हैं हमारे जानने में जिनकी PSA एक जमाने में 10, 20, 50 और 100 थी, और उसके बाद PSA 0.1 और 4 के नीचे कम हो गई, up to 4 which is normal limit, तो हमारे लिए जरूरी है कि PSA को हम एज आइसोलेटेड टेस्ट ना ट्रीट करें. मेरा ये भी रिक्वेस्ट है, जितने भी सज्जन आज ये देख रहे हैं, don't get into the business of getting into one test and the test is abnormal. A doctor is interested in using multiple tests. What are the tests a doctor uses? First is your language. He talks to you and picks you completely. It's like an interrogation, जैसे CBI interrogate कर रही है, वो between the lines सब कुछ पकड़ लेती है. तो डॉक्टर वो जो वार्तालाप करता है, आपको कंफर्टेबल फील करने देता है, उसमें वो सब चीजें पकड़ लेता है जो आप बताना नहीं चाहते, जो शायद आप मिस कर गए या जो शायद graceful aging के साथ हो रहा है. So those changes which are gradually happening, which you may not be aware of, is picked up on a routine talk and then an examination. Very important. This is the crux of a doctor in any specialty in the country, in the world. Once that is done, they ask for focus investigation to actually look at their working diagnosis being solidified for them to treat and finally cure you. So don't look at doing a 10 investigations and asking your doctor ki ye hai. These are strong statements when a patient needs to wake up when he reaches his doctor. He already carries 10 reports around and he's given those reports for a doctor to study. The doctor is least interested in those reports. He wants to know why the tests were done to start with. आपने टेस्ट कराया क्यों? Why did you do a urine routine? Why did you do ultrasonography? Why did you do a uroflowmetry? That means somebody learned has actually asked for these investigations, and that is what we ask for all patients who are elderly. Elderly may not be 90. I would look at patients complaining. So complain of the prostate issue starts in their 30s, 40s with prostatitis, and 40s, 50s onwards till 80s, 90s, and 100s when the people live very well. They actually need to look at the obstruction to the flow of urine. If they don't pick it up, we pick it up. They come for executive health checkup. When they come for executive health checkup, they want to see all the reports should be normal. Ye report red kyun hai, more report zyada kyun hai? And they also get the sonography which shows prostate is enlarged. They say, please go and see Dr. Vijay, Dr. Ismail, and Dr. Pandey. The moment they are sent to a urologist, urologist will be interested in, do you have any complaints? And everything starts pouring up. Patient starts singing the language which a doctor wants to hear. Complaints or no complaints. We still corroborate it with the right evidence. Sadly, I'm corroborating it that way because we need to pick up the right kind of a picture, finally to treat you and understand which station are you in. So that's very important. Let's look at an example. I told you that the prostate is actually below the urinary bladder. That's a urinary bladder which you saw up there, and the prostate is here. It's below the bladder. The door is just at the junction of the room and exit. So if this prostate is enlarging, it should enlarge in the location where it is. अगर मैं कुछ करता हूं तो अपने घर में करूं, दूसरे के घर में ना जाऊं. पर यहाँ example देखिए, on the left side, the prostate has actually come out from his house and got into the bladder. So that is a median lobe enlarging into the bladder. This prostate is actually, that part of the prostate is enlarging into the bladder. The black one is all urine. That's a urinary bladder. This black thing which I show you is a urinary bladder right now. So the prostate is below the bladder. Now what has the prostate done? In its enlargement, it has started growing into the bladder. Even my specialized fingers of 24 years of practice can still not pick it up because this is something which is gradually going in. And have a look at the right side. Right side is a cystogram picture where you find there's a contrast. The white thing is the bladder. The bladder should actually have been till here, but that's not true. This whole thing has been occupied by the prostate, which has gone all the way deep into the bladder. So आप अपने घर से निकल के किसी और के घर में घुस गए. Therefore, you can understand how much of obstruction it must be causing because the median lobe will almost choke the prostate like that. So it's completely blocking it. And this patient may have a poor flow. So as a urologist, when I see a sonography report given to me by a patient or from a health checkup, I come to know that this patient may be blocked. He complains or doesn't complain is a completely different issue altogether. So for all respected colleagues who are of my age, I'm 51, to people who are double my age, it is important for them to wake up that the prostate is undergoing a silent change. You will never know it. It's not about a menstrual period closing down and you get into a menopause. It's a silent change of hormones which men go through. The libido changes, the capability in the bed changes, the capability in the toilet changes. It all changes because the hormones and the organs undergo a change. Therefore, what is the test of choice which a urologist wants to do? You can see that I told you uroflowmetry. Please understand that very well. Metry is measurement, flow is speed, and euro is urine. To me, in my language and my definition, it is the ECG of the urinary bladder. What does it mean? If you have a chest pain, a doctor will not open your heart. He will just do an ECG and will know everything about your heart. किस vessel में block है, कहाँ angioplasty करना, किसको bypass करना, नहीं करना, सब कुछ. So an ECG, a non-invasive investigation, tells all about you. Sadly, you should not come with chest pain. You should come before that. So ECG is a part of a health checkup which you should do. Similarly, When you come to me for some reason in the lower urinary tract, which means urinary bladder and the prostate, the first test will be, do you pass urine well? If you say yes, then please look at the flow. Then your flow, both men and women, will have a great flow like this flow. That means you pass urine in one good go, the bladder contracts, the passage open, urine comes out. But that's not a reality. The reality is gradually changing. So when you pass urine in a full bladder in a computerized toilet, which is shown to you on the left side, which is exactly outside the room out there, which happens from morning till evening, where people come in full bladder, show us the best flow for us to understand at what level are in. Have a look at this gentleman whose urinary flow is gradually going down. And after the urinary flow, when we do a sonography, we know how much of urine is left over. That's called a post-void residue. So imagine uroflowmetry is a stronger test than a sonography. A sonography is where a respected radiologist or a sonologist would look at something. What? The static changes. He looks through the full bladder, which is the window through which he looks into the prostate, and tells bladder mein stone hai ki nahi, prostate kitna enlarge hai. You saw the picture of a prostatic enlargement. That is a sonologist on the left side. He has taken a picture, he has given you it. But he cannot tell what is happening to you. It is your job to pick up and identify that and help you out, which means you have to complain. Only a crying baby gets a milk. अगर नहीं रोए तो बच्चे को दूध भी नहीं मिलती. Simply आपने complain नहीं किया तो कोई treatment नहीं मिलेगा. और क्या होगा? एक दिन आपका flow यूं धीरे धीरे घटता जाएगा and become narrow. Finally you will pass little, drop, and your bladder will be too full and pregnant. By the time you come, the kidneys also may have got the toss. So to me, at this point in time, it's important that people understand this. We move forward. We're just somewhere around the corner to close it around. I did talk about prostatitis and urinary blockage. For some people who came late, I did talk about that. I also did talk about a 105 years old male. Imagine 105 years young male, I would say, who had an obstruction to the urinary passage and was in retention. We won't play the video. We'll move forward and come to the next level. We will look at something else. So we did talk about signs and symptoms of benign prostatic hyperplasia. Benign शब्द मतलब non-cancerous change. 80 to 90% लोगों में non-cancerous prostatic change हो रहा है. ये मैं आप लोगों को जगाना चाहता हूँ. और बहुत slow हो रहा है. कोई घबराने की बात नहीं है. आपकी यूरिनरी स्ट्रीम घटती जा रही है, यूरिन फ्रीक्वेंसी हो रहा है, ड्रिबल कर रहे हैं, जोर लगाना पड़ रहा है, पूरा खाली नहीं हो रहा है, बार बार जाना पड़ रहा है, रात को जगना पड़ता है. इसमें घबराने की क्या बात है? It's an age-related change. We all know that where we are going to finally. But we will have to live in good health, in safe health, in health which actually should not be compromised with an emergency that suffers. Your body suffers and your family suffers. So it's important for us to wake up to that kind of phenomenon. We move forward and look at, as I said, finally for those people who have joined late, weak or interrupted stop and go flow of urine, sudden urge to urinate because the bladder is contracting erratically, frequent urination more at night, trouble starting to start your flow, which is hesitancy, trouble emptying your bladder completely, which is incomplete evacuation because the bladder cannot push anymore in the background of an obstruction, pain or burning while urinating, which is an inflammation or an infection, blood in the urine or blood in the semen, and pain going all the way to the back and the hips, possibly because that you have got an obstruction affecting all the way kidneys. And sometimes you may come with a silent kidney failure, which is all about shortness of breath, tired, creatinine going up, sadly, which should not happen to anybody in modern world. So these were the signs or symptoms of people who are joining late. I did talk about a larger prostate issue where the prostate was gradually getting blocked and the passage is completely tightening. For whatever God gave a narrow passage, I just asked God, He could have given a broader passage and urologist would be resting and not doing so much of work here, but that's how it is. I did talk about complications. If you delay, if you ignore, and if it is advanced without your knowledge, then these are the stuff. Bleeding in urine, urinary retention where urine is completely blocked, infection, stone formation, kidney failure, and because the bladder has been made to contract, knocking till the bladder weakens up, called hypotonic bladder, where even if I do a good surgery, finally the bladder may not contract because it's years of problem that the bladder has taken up. So for us, today it's important for us to take health to the front row seat, that we are identifying ourselves as becoming self-reliant and dependent on ourselves, and we choose our best friends in all fraternities to look at how will we invest best, how will we look at our future best, how will we look at our children's future best, how will we look at health best. We also need to identify that what we are going through. If you're going through something or we have a background of something, we should wake up. I must tell something here is that India is also a diabetes capital of the world. Sadly, diabetes is again a disease more of a quality of life and health related change, which is a lot genetic, but is also worsened by the kind of lifestyle we're leading in. It does not mean that you should not stay home and stay safe. but get into a picture where you do exercises, keep your sugars under control if you're a diabetic, because a long-standing diabetic and diabetes जो बहुत सालों से है और जो diabetic uncontrolled है, उससे ये होता तो है कि इन्फेक्शन होता है, इन्फेक्शन और डायबिटीज एक दूसरे के दुश्मन है, वो इन्फेक्शन होते रहता है और डायबिटीज कंट्रोल नहीं होता है। साथ ही साथ बहुत इंपॉर्टेंट है कि ये ब्लैडर कमजोर होती जा रही है। आपने कुछ शब्द सुना होगा, डायबिटिक रेटिनोपैथी, आंखें खराब हो जाती है लॉन्ग स्टैंड डायबिटीज में, डायबिटिक नेफ्रोपैथी जिसमें किडनी खराब हो जाती है और किडनी की ट्रांसप्लांट लगती है, एंड वैसी होती है डायबिटिक सिस्टोपैथी जिसमें ब्लैडर ही खराब हो जाती है, उसकी कॉन्ट्रैक्शन पावर और सेंसेशन कम हो जाती है। तो डायबिटीज से बड़ी बीमारी कुछ नहीं है, कोई बड़ी बीमारी नहीं है। डायबिटीज ऐसी बीमारी जो साइलेंटली आपके घर में घर कर जाती है और घर में फिर हर ऑर्गन को तंग करती है। So diabetes control is extremely important, that you've taken up exercise, you've taken up yoga, you've taken up all that. In this challenging times around, keep on to it, stick to your lifestyle. It is important for us to control our diabetes to highest level, because while the organs are undergoing organic change, there is a change happening with your blood sugars shooting up and down. आपने अगर आम के मौसम में खूब आम खा लिया, शादी के मौसम में खूब मिठाई खा लिया, फिर कंट्रोल करना चाहते हैं, it does not augur well for you and for your doctor. मैं एक छोटी सी चीजों के साथ खत्म करने की कोशिश करूंगा, and then we'll come to some questions and answers. Is about something which is getting up multiple times at night and bedwetting at night. ये बहुत इंपॉर्टेंट चीज है, शायद किसी मेडिकल सब्जेक्ट में और किसी अवेयरनेस ड्राइव में कवर नहीं होती। हम शायद बार बार नहीं उठते हैं अपनी 20, 30, 40 साल 50 साल की उम्र में, पर हमारे पेरेंट्स और हमारे ग्रैंड पेरेंट्स जो 60, 70, 80 और 90 साल के हैं, उनकी नींद बहुत ही शिथिल होती है। उनकी नींद वैसी नहीं होती जिसमें उनको बहुत गहरा नींद आया जैसे हम खराटे लेके सोते हैं। दूसरा, उनके लिए रात को पेशाब ज्यादा बनता है। So elderly people produce more urine at night. It is because of the hormone changes and because of vasopressor gene activity happening around. Number one. Number two, their sleep is less. If that is what is happening, we did work on this and we opened up a clinic which is called Nocturia and Bedwetting Clinic. Let me tell you what happens around. So nighttime urination and bedwetting are treatable completely. That I see children, that I see adolescents. I even see people who are in their 20s and 30s and come and say, I'm bedwetting, doctor. I've been bedwetting since childhood. I'm bedwetting after something. And bedwetting is a very sad story. It's again related to an issue which we need to wake up today in this month, because people have continued to live with bedwetting, continue to live with passing urine multiple times at night. It is important that we wake up to this phenomenon. And for us in 2017, April, when we published this in Jaglaya, actually a Marathi newspaper in English, and as a question answer, 9 patients came from a place which is 2.5 hours away, not Delhi, Thane. So from Thane to Andheri, it takes 2.5 hours in a busy traffic in the city of Mumbai, which is trying to get back its infrastructure to the fold. Patients came with this newspaper and said that we get up multiple times at night since years. We have told our doctors, what have you written that you can treat it completely? I said, we made a strong statement for people to wake up. This was a genesis of we launching a very important clinic called Nighttime Urination or Nocturia and Enuresis of Bedwetting Clinic. It has gone far in the last 3 years. We're close to 400 plus patients have come only for nighttime urination or bedwetting. Though they have complaints in daytime, which have adjusted to nighttime urination is dangerous. Elderly people have got arthritis. They have got Parkinsonism. They have got difficulty in cognition. While you and I snore and sleep at night, they get up and sometimes they have a fall. It is important for us to look at nighttime urination can be completely managed by a behavioral therapy and by a medical therapy, by a urologist and by other doctors too. Very important for us to understand this. I must stress few minutes here. Number one, people who get up multiple times at night, people who are elderly should cut down their water intake at night. मैं उनको बोलता हूँ कि आप जैन बन जाइए, शाम 6 बजे के बाद पानी वानी सब कुछ अपने जितने बेवरेजेस हैं वो सब रात को पीना बंद करिए. So tea, coffee, alcohol, water, all should be stopped at night. Better drink in the daytime. You are going to produce a lot of urine as an elderly person, even if you drink a sip of water or a bucket of water. So why drink buckets of water whole night? And why do Indian people have to drink milk at night? Why don't you cut down everything in the evening time? Because if you drink more, you pass more. And to pass more, your bladder has only got this much. ऐसे भी वृद्धावस्था में नींद है नहीं, हम बिल्कुल जगह हुए बेड पे सो रहे हैं और बार-बार ब्लैडर भर रहा है, हम बार-बार यूरिन पास करने जा रहे हैं. And we continue to live in agony. Patients have gone to doctors and said, I get up multiple times at night, and doctors have not taken deep interest. They've given some medicines which are sleep medicines. They've given some medicines which may not treat, and people continue to live in it. In this very place where I live in Andheri and work around, people have come and said, why did you not open this clinic earlier? So to make you understand, nighttime urination happens because of many reasons. The first reason is what I was pointing to you in red. Nocturnal polyuria, ज़्यादा पेशाब बनना. All diabetic people have got polyuria or global polyuria, दिन और रात. BPH, my disease, that means prostate issues, where people actually produce more urine at night. Detrusor overactivity, bladder contracting again and again, bladder capacity getting less. But that is the domain of a urologist. There are other causes where nighttime urination is increased. When uncompensated heart disease, untreated diabetes mellitus and diabetes insipidus, elderly women with estrogen deficiency, and what I requested, become a Jain in the evening because primary polydipsia. अगर शाम रात को आप पीते ही रहेंगे और कुछ भी हो पानी चाय कॉफी दूध alcohol, you will get up multiple times at night, and those people who have got sleep problems. So nocturia or nighttime getting up multiple times is sadly a situation which people go through, and it's not out of public domain. Frankly speaking, we do a frequency volume chart, we study the patients, and there's a treatment available. We do behavioral therapy, we look at less beverages. Tea, coffee, and alcohol produce a lot of urine because they are diuretics. They work on the kidney where you have got no role. Your role is in the bladder. You have to control and probably pass. But the kidney's function is independent of you. It actually decides what it has to produce around. So the treatment here is about looking at prostatitis, where if there's a prostatitis or infection, there are antibiotics, there are medications. If there's an enlargement of the prostate, a doctor would treat you with medicines which can reverse you. Imagine what a urologist can do for you in this world. A urologist in your city can actually reverse you. While every year you cut a cake and you become 1 year less younger or 1 year older, and people clap for you for that, you're actually getting older. Your prostate is undergoing a change, I would say enlargement or a blockage, whichever it is. But out here, a urologist could bring about an alpha blockade. There are a set of medications which can bring about an improvement in the flow. अगर फू करेंगे तो भी दरवाजा खुल जाएगा. So there are medicines which can open the door, number one. There are other medicines which actually can shrink the prostate. While you are going from 60s to 80s, your prostate will become from 60s to 30s. That means that gradually the prostate can be shrunken. This can only happen if you come in time. These are called 5-alpha reductase inhibitors. These are very specific drugs. They act on the prostate, and as I very clearly said, the prostate can be shrunk gradually to bring about improvement in the flow. So what are you waiting for? It is important for every man to identify himself today evening when he closes it down for his second tea, which ladies will serve you in 20 minutes plus. Prostate can be shrunken. We can make you younger than what you were, not on your age and your black hairs turning gray, but on your prostates getting younger, your flow getting better, and people have done that. So there are medicines both for the bladder and the prostate. There are medicines for the prostate to improve your flow and shrink the gland. There are medicines for the bladder to improve your flow. Sadly, if you come late, that means you come when the medicines are not acting. You come when the urine is almost completely blocked. You come when there is bleeding in urine. You come when the obstruction is for a very long time and you ignored or delayed or it's just advanced because of your not being knowing this, or you did not invest your Sunday evening 5 to 6 p.m. with Dr. Pandey and with Kokilaben Hospital and with Dr. Reddy's initiative today to take this subject forward. You come late. And sadly, this is a surgical disease. बुखार के लिए कोई सर्जरी नहीं करता, फीवर के लिए लोग दवाई देते हैं पैरासिटामोल, लेकिन कैंसर के लिए लोग ऑपरेट करते हैं. So there are surgical diseases, there are medical diseases. Prostate enlargement and blockage is a surgical disease. In today's world, with the help of the pharmaceutical companies who have taken research to highest levels in India, with the help of pharmaceutical companies which have actually brought the medicines which were launched in America yesterday, could be launched in India tomorrow. I salute all the pharma companies who have taken up these kind of platforms where me and my colleagues are able to read the society. It is so important for us to understand that we can actually shrink your gland if you come in time. So doing a health checkup is good. Identifying yourself is good. Picking up the wrong issues which the urinary system is going through is good. To do that, see your doctor. See your urologist in your city and get it sorted out. Look at this gentleman. It's in Gujarati newspaper mentioned that he was a 105 years young saint from Kutch. He's there in the photograph. I'm just missing because I decided to stay away. He came in December 2015 with blockage of urine at the age of 105. Nobody could put a catheter from below because this was completely choked. They put a urinary pipe to the tummy, which is called suprapubic cystostomy. He roamed around the country with that bag and nobody could actually dare to think about a surgery for 105. We all are scared if something can go wrong. We at Kokilaben Hospital, the team which I mentioned, Dr. Bijoy, Dr. Ismail and myself, looked at giving him a cure. Cure at the age of 105. Yes, I'm telling you the truth. This gentleman at 105 underwent a prostate surgery where by laser we cleared his prostate. It took a few weeks to recover. All his reports were as good or better than you and mine. And finally he went home. He came on a regular checkup from Kutch. Later on he came on a yearly checkup. I must confess that in this lockdown, he left for heavenly abode. He was 110. So cancer prostate also presents as enlarged prostate. Cancer prostate, sadly, is a cancer which I wanted to talk in last few sentences. is a cancer which can be managed and manipulated completely hormonally. At the age of 80, somebody has a cancer prostate or increased PSA levels, I don't think we'll worry about. PSA is an organ-specific marker. If it is happening in a cold situation and not in a retention of urine, a urologist PSA को chase कर सकता है. He will give antibiotics and try to get the PSA level down. He will also examine you and look at if the prostate looks abnormal. He may do an MRI pelvis and find that there is a score which shows that the PSA is suspicious. He may then do a prostate biopsy and prove that this is a cancerous prostate. The cancer prostate can present in two ways. Again, because as prostate enlarges and does not present on the face of a patient, the prostate cancer also may not present like that. And sometimes it may present as a spread disease. It should not happen. It's very important for us to know that. So it's very important for us to know that it could present as a spread disease, and that situation, we can actually manipulate everything hormonologically. Please believe me if I say every urologist in the country has got 1, 2, 500, even 1,000 patients who had advanced cancer prostate. Advanced cancer prostate when the patient came to them. Spread to the bones, spread to the lungs, spread to everywhere. And only with those wonderful medicine which has been brought to India, where we can reverse the entire situation around. Can you imagine? This cannot be done in any other disease around. Other diseases require a chemotherapy. This is not chemotherapy. These are all hormone manipulations, which only a prostate cancer in a body can take. Something in a woman can only be done for breast cancer. So as breast is a hormone-related gland, prostate is a hormone-related gland in men. And as a result of which, hormone manipulations can be brought about when you look at that. So if somebody is sadly detected with cancer prostate, I would say no panic, please. I would say, please, no panic. The reason is we don't panic as doctors and we request patients not to panic. Not that every patient is a case to us. We get into the shoes of every patient, understand his family, his nuances, his cost issues, his travel issues, and then look at his future. So as a doctor, please remember, every doctor is thinking out of the box when he looks at you with his disease process. He breaks the news very, very comfortably and gently to the family, takes you into confidence and tells you that this is a cancer prostate, but not to worry, because this is one disease where we can treat, we can cure, and we can prolong life like no other cancer in the world, like no other cancer in the body, because it can be manipulated hormonologically. I will tell you that patients came जिसमें spine में involvement थी, spine तक फैला हुआ था, और उसके बाद मरीज चल नहीं पाया था, स्ट्रेचर में आया था. कैंसर प्रोस्टेट स्पाइन तक स्प्रेड है, लंग्स तक स्प्रेड है, बोन्स तक स्प्रेड है, और कुछ हार्मोन मैनिपुलेशंस, कुछ बहुत छोटी सर्जरीज, कुछ बहुत ही इंटेंसिव दवाइयों के साथ जो कीमोथेरेपी नहीं है, ये पेशेंट अपने पैर से चल के वापस घर गया और आज कई सालों के बाद भी जिंदा है. इनकी प्रोस्टेट में रुकावट थी तो किसी ने इंटरनली प्रोस्टेट की सर्जरी कर दी. ये बिकॉज ये स्प्रेड डिजीज था. आज दुनिया बहुत बदल चुकी है और कैंसर प्रोस्टेट के लिए हमारे पास वो टेस्ट और टेक्निक आ चुके हैं जिसमें क्लिनिकल एग्जामिनेशन के द्वारा एक डॉक्टर 50% कैंसर पकड़ सकता है. तो हर यूरोलॉजिस्ट आपको एग्जामिन करता है और मोशन पैसेज के थ्रू प्रोस्टेट को फील करके अपना सस्पिशन रेज करता है. पीएसए टेस्ट उसके बाद फिर एक मार्कर बनती है उनके लिए. अगर पीएसए में एब्नॉर्मलिटी दिखती है, फिंगर एग्जामिनेशन में एब्नॉर्मलिटी दिखती है, तो अवश्य वो एक एमआरआई करते हैं, अवश्य बायोप्सी करते हैं, फिर वो आपकी बात नहीं सुनते बिकॉज वो आपसे जल्दी आपकी डिजीज को पकड़ना चाहते हैं. So a doctor or urologist is interested in you in this city and in every city around, which means that we want to pick up a disease which is curable. And what is curable? Which is a localized prostate cancer. A localized prostate cancer can be removed completely. अगर कैंसर यहाँ पे है तो इसे काट के निकाल सकते हैं, इसको इससे जोड़ सकते हैं. So in other words, the prostate can be removed from here and the bladder can be joined to the urinary passage. We did one case yesterday by a robotic technique. We did one case yesterday in a 66-year-old man whose prostate cancer was localized to the level of the prostate. We removed the entire prostate and we joined the bladder to the urinary passage. Come Monday, tomorrow, we are doing such 2 cancer prostates by the team in which one man is 74, other man is 59. So it does not see age, it does not see ethnicity, it does not see religion and color. It comes because there's a hormone change happening. The hormone change, if happening in the right direction, you possibly are getting a BPH or a benign tumor or an enlargement of prostate, which causes blockage of urine. It sometimes can cause a blockage beyond it, and a cancer prostate can be just a deviation from there because of hormones. So frankly speaking, it is something which you should be aware of. So today we don't cut across, we go in and by the robot that we have, we've got 2 robots back in this hospital, and there are robots which is be used across the world. So robot is not the surgeon is sitting here, or the surgeons are urologists. Surgeons are the ones who remotely and with efficiency and with a very high level of artificial intelligence would actually work with the help of an anesthetist and a team of nurses and a kind of a setup that happens in these modern hospitals. we are able to go by a minimal invasive therapy, which was minimal invasive called laparoscopy, has taken way to a new kind of a technology which helps us to be more efficient, more three-dimensional inside the body without cutting open. And that is what we do as a robotic surgery. That's what I do. That's what my colleagues do here around. Something which you need to know. So cancer prostate is not uncommon disease in the elderly. Young patients may have an aggressive disease. So if I see somebody who has got a cancer prostate in his 40s, 50s, 60s, and 70s, I don't wait. Therefore, it comes important that who should be screened for a positive prostate health? Number one. So let's come to that important sentence. All people who are in their 50s, 60s, 70s, 80s, and who have got urinary complaints should see a urologist. Should not postpone. If there's a bleeding in urine, should see them immediately on the next possible working day. If you are constipated, please come out of constipation. Don't become a PICU. Constipation can only worsen your situation. You are already at the edge. Constipation can bring about a blockage of urine immediately. So prevent that happening around. While I talk about this, we also look at PSA as a surrogate marker. We look at PSA as a health checkup marker for all people who had their fathers or their brothers as cancer prostate should actually undergo an yearly PSA screening. All people who undergone a prostate surgery for a prostatic enlargement, which is called a TURP or a HOLEP, still need to know that entire prostate has not been removed. There was no cancer prostate. The prostate was enlarged and the prostate was blocked. तो जो डॉक्टर आपकी प्रोस्टेट की सर्जरी करते हैं दूरबीन के द्वारा, जिसको हम TURP कहते हैं या होलेप कहते हैं, उसमें प्रोस्टेट अंदर से निकाल दी जाती है. जैसे आप कोकोनट अंदर से खाते हैं और बाहर का छिलका छोड़ देते हैं. बाहर का छिलका प्रोस्टेट का कैप्सूल होता है. और अगर प्रोस्टेट ने कैप्सूल छोड़ दिया है, छोड़ना पड़ता है बिकॉज आप इस रूम से दीवार को नहीं हटा सकते, सिर्फ सामान हटा सकते हैं जो ब्लॉक कर रहा है. ऐसे कंडीशन में प्रोस्टेट वापस ग्रो कर सकता है. ऐसे कंडीशन में प्रोस्टेट में कैंसर हो सकती है. तो फ्यूचर में अगर आपने प्रोस्टेट सर्जरी पास्ट में करा है, फ्यूचर में आपको अपने यूरोलॉजिस्ट को जाके मिलना ही है. आपने अपना शहर बदल लिया होगा, आपने अपना देश बदल लिया होगा, लेकिन क्योंकि आपको TURP या होलिप किया गया था, आपने अपने रेसिडुअल प्रोस्टेट छोड़ा हुआ है. इसका मतलब है कि साल साल आपको जाकर के अपने यूरोलॉजिस्ट से मिलने की जरूरत है. A very important thing. People think that in a benign disease we remove the entire prostate. Not true. In a cancer prostate, when we bring about a cure, we remove the entire organ because the organ is cancerous. And that's where we remove the organ and join the bladder to the urinary passage to bring about a control in the flow. So very important for that. So screening is important for those patients who are at the high risk, or everybody who sees a urologist. A doctor will decide what is to be done. So it's important that if you are elderly, if you are young and you are aggressive, you got to see your doctor. So as I come to a close, I would look at prevention, and there is no major prevention around. If you could prevent your age from changing, if you could prevent your black hairs from graying, you could have changed that. So the prevention could be staying healthy. Prevention should be staying informed. These are important things. Investing yourself in your health, in your family's health, in the health of your father and grandfather. Very important. So just to summarize and come to a close, prostate health is important. September happens to be a prostate health awareness month. Every year by the platform from Kokila bin Dhirubhai Ambani Hospital and by colleagues in pharmaceutical industry who actually reach out to you by a newer ways of reaching the platform that has been created to such high levels. Today, I would like to thank Reddy's Labs for this. My last slides are thoughtful for you, so you should wake up to it. I take a long time to start urination. If it's a young man, it may not be prostatic issue. It can be 20s, 30s, and 40s. It could be a urethral block. It could be a stricture urethra. If it's an elderly man, it almost always is prostate enlarging and blocking your urinary passage, and your bladder is not able to generate that pressure to push urine out. So therefore, more pressure is required. If you're constipated, you can worsen up. And women who have no prostate still could have very similar symptoms ki urine khul ke nahi aata, because there are hormone changes happening and the passage is tightening up. You need to be evaluated by a uroflowmetry and ultrasound. See your urologist. I have bleeding in urine. Sometimes you ignored it. Sometimes it was partially investigated. You saw your doctor, and finally one fine day you land up with excessive bleeding. Not acceptable. So all these patients need to know that all bleeding episodes should be taken to a logical conclusion, because it could be stones, it could be infection, it could be a cancer. Passing urine multiple times at night, which is called nocturia, or bedwetting, which happens in children. We should treat them in time. All children between 6 to 15 years need to see their doctor, need to see a urologist or a pediatrician, as simple as that. There's an attached social stigma to this. Multiple times getting up, bedwetting, not able to sleep at night. Next day morning, you are not in shape to be able to perform your duties is important. Straining to pass urine for many years. You had a road traffic accident. Possibly there could be a stricture or a blockage in the urinary passage. Prostate may not be your cause because all this happened in young age. Friends, finally at the end of it, nighttime urination is a big time issue which people need to be aware of. It's a very prevalent kind of an issue called nocturia. It also comes in the domain of World Sleep Day. Every night when you sleep, the World Health Organization says that March 17th is the World Sleep Day. Please sleep soundly and nurture your life. Very important to understand that getting a multiple times at night was not your aim, but because the body is forcing you, we have to bring about behavioral changes, we have to bring about medical changes. Similarly, there is World Bedwetting Day. Last Saturday of every year, we celebrate World Bedwetting Day. This time it was a Tuesday on 24th of May. We did talk to all children, to all pediatricians, and made them wake up. And therefore, all parents said bedwetting is not right. As I told you, we set up this important Nocturia bedwetting clinic because we wanted dry nights for good mornings to everybody. Friends, India is glittering. You have a time for second tea in India at this point in time, which is being served by the ladies of the house. It is important for you to identify yourself, which you identified. I was on a monologue at this point in time, but it was also a dialogue. I saw some questions coming up. I saw some comments coming up around. I wanted to concentrate and take it forward to the highest possible level because you hardly get to know in real terms, in a layman's language, that prostate issues are completely treated. While every doctor works in his subject and works hard, it is important for us to understand that it is always we is stronger than I. I alone cannot do it. We have a team here. We have a team of urologists. We have a team of support staff. Similarly, we have a larger team of the hospital. We have a management which looks into various departments, and we have a correlation happening with various departments. Same happens to other hospitals too. It is important for us to wake up to the agony of individuals who suffer. It could be a silent suffering where they don't know whom to reach. And therefore, it was today to make you understand that if you have urinary complaints of any kind, if you have got something picked up in your kidneys, bladder, prostate, and etc., it is important for you to wake up. It was important also to give you the good news. And the good news is prostate cancer awareness and early management is the key. That is an expert talk question answer which actually appeared in the India Today. A copy of it I could pass on to you because you could pick up my email and my tweet addresses somewhere, and somewhere in the program I put it across. You get to know that I am reachable in many ways around. Finally, the motto today was impossible to possible. To bring a very super specialized subject finally to you, to bring about a treatment, to reverse your age, to get your prostate, understand the reversibility, to prevent a surgery which is a final cure, is all about getting you to understand that this is possible. While every colleague in the audience today says, I love my doctor, I love my urologist, I would enthuse everybody who knows that he has a urinary complaint to not postpone it. He could be anybody. It could be in 50s, he could be 90s. It does not mean elderly people would not get their treatment. Elderly people deserve the treatment. They have done all for all of us. And therefore, all fathers and grandfathers deserve the treatment that we owe to them. I also want to tell you that I'm looking at various platforms, and probably starting next week, 5 o'clock, I should be on my YouTube channel. It is important that those awareness drives which have not reached you ever are actually on my YouTube channel. So if you type Dr.Sanjay Pandey Urology, you actually get to know a lot about prostate and about robotic surgeries and all things we do to reconstruct and treat patients around. Many of the awareness drives which I have spoken across the world, of the kind which I speak today from a wonderful platform created by Reddy's Labs at the Kokilabin Hospital today, I think is available there, and you could get to know more about it. I would probably take a break from here onwards and understand that next week onwards, next Sunday evening onwards, 5 o'clock, I should be available on the YouTube channel where you don't have to really log on the Facebook and have trouble not being able to log on. YouTube is a more easier channel for you to just subscribe, get in, and probably get active. So to end, next time if you think of prostates, which could be BPH, prostatitis, and cancer prostate. Next time if you think of stones, renal, ureteric, and urinary bladder stones. Next time if you think about urinary incontinence or leakage of urine, which could happen in children, elderly, women, for whom I will speak on at 5 o'clock on the next Sunday, which is 20th, urge, stress, vesicovaginal fistula. If you think about obstruction to urinary passage, which could be stricture urethra or extrophy bladders and peronees, you think of kidney failure and ESRD, and you think of urological emergencies, think urology. Think about the teams which actually work hard 24/7. Think about not creating an emergency. Think about improving your quality of life. Think about not having constipation. It is only a very focused audience today which actually has come in and would possibly see a recorded version of it, would get to know that we are deeply interested in your positive health, a positive prostate health in the month of September. It could be cancer prostate, which we can cure or probably bring it back even if it has spread. It's a prostatic enlargement which we can treat and not let you get obstructed in your lifetime, or cure you if you're obstructed by a good prostate surgery, and finally treat your prostatitis and make you aware that prevent one more infection, which is more common in women and should not happen in men. The bad news is time flies and time has flown. The good news is each of you are pilots. It's important that you being the head of your household, head of your place, take those good things, the good messages around. Friends, all good things need to come to an end. The good news is that you became a pilot. Take home is that every patient tells a story. Sadly, sometimes it tells a story too late or tells an emergency. Every doctor lives a passion. That's his only purpose. Dedication and inspiration need not be recognized or rewarded. So there's no reward recognition which a doctor works for. It's ultimate sacrifice a doctor does in the most unearthly hours and circumstances. And while we still continue to fight this COVID, which will surely go on till next year half, COVID warriors are doing their best. Stay home and stay safe, even if unlocked, because your faith in doctor and the health has already moved mountains. It will move more as you move forward. Our road to success owes to awareness, awareness, and awareness. I spent this Sunday evening to take it forward to the highest possible level on management of urinary issues. And I bring you greetings from the Department of Urology, from my colleagues who actually happen to be my teachers and my best friends around, from all of the fraternities at the Kokilaben Nirumai Mani Hospital, where we look at everything from school awareness programs to reaching Rotaries and Lions, reaching ladies clubs, reaching geriatric population, and reaching various kinds of teams which you look at. So next time, if you think of these, also think of yourself, because you could be game changer. You could actually bring about the motto that we follow: every life matters. So to me, life-saving, life-changing, life-extending, and life-modifying treatment for critically sick and needy patients, and for individuals in society who are still not sick and should never be sick, it is important to bring you all to active and fuller lives, which you have already redefined for yourself. Friends, in the words of needy children and elderly, stitch in time saves 9. Like we look at bedwetting and look at giving them back their childhood, their esteem growth and their direction, and focus bedwetting and nocturia clinics that we have at Kokilaben Hospital. We got to go back and say that we will do good. So prostate disease will always be a burden. The burden will only increase. It's a jigsaw puzzle, and therefore taking them to a logical conclusion is the truth of the moment. While I did and finished this, I heard somebody in the audience say, honey, I'm off to appointment with my urologist. And that's great, because you had complaints and you wanted to wait. Now it's a time not to wait. If you have a complaint, see your urologist and he will take care of you. He's capable enough to pick up all those important leads which you have not talked about or not thought of. And he will investigate you through uroflowmetry, a urodynamics if required, an ultrasound, a serum PSA, and put you in your path of recovery or path of good health, a path which will rejuvenate you and make you younger. Friends, I come to a close. This has been a little longer than I had expected, but I wanted to speak my heart out, because the age at which patients present, the presentation not in the OPD, but sadly in the emergency in COVID times, the need for you being aware and investing your time in your own health, health of your fathers and grandfathers, and the expectations that you carry sometimes, sadly, on a strong statement. You cannot buy health. You really can't buy health like you go and buy something in chroma. You've got to reach in time, because that time is always late. And therefore I said a stitch in 9 saves 9 kind of thing. So truly a challenge and a dream, because treatment delayed is life. You could tweet me here, you could go to the YouTube, or you could go to my mail and probably leave some messages around, something which you go through around. I will take some questions as we move forward. So to start with, there is a question which, are there any side effects of prostate medicines? Wonderful question, sir. So let me answer this in a very, very positive way, because I have attempted positivity today in the last 1.5 hours. Side effect is a worry that you have which should not endanger your life, which is important. So every medicine which we give to a patient has got some effect which is wanted and some effect which are unwanted. The unwanted effect is what you may not like. The unwanted effect should not jeopardize you. Very important. In relation to the prostate issue, let me talk to you. There are medicines which are the alpha blockers, which come by name tamsulosin, alfuzosin, naftopridil, and silodosin. Various medicines which you eat. I talked about the pharmaceutical names. All these medicines are known to bring about postural hypotension. When a doctor writes a medicine, which I do regularly 6 days a week, I turn the prescription across and tell them, this is a medicine, there could be a headache, there could be a postural hypotension, there could be a problem. So you could ask your doctor when you write your medicines, and which modern patients do ask, and I feel good about it. So when you have that question about, does there be a side effect on a medicine? Possibly yes. The side effect is an effect that your doctor is possibly trying to keep it as low as possible by giving you the right dose. And therefore, nobody can be treated too remote. In today's world that we treat patients on the official Skype consult that I see many patients on from different cities, to treat somebody, I have to spend more time to tell them that there could be a side effect. Be aware, not to worry. So the effect that is unwanted in today's world is labeled as a side effect. We don't want side effects to endanger you. And therefore, we tell you that postural hypotension in prostate medicines is not uncommon. On the first day, you may possibly get some degree of reeling of head or maybe even a syncopal attack or maybe feeling a little giddy. If you feel that, you should get up very slowly. This effect naturally and gradually dies down. So a first dose effect or a first day effect or an effect which lingers in a prostate medicine called alpha blockers, which we give to everybody. We give to everybody to improve the flow. Any and everybody could get this. But where do people get it? I have not remembered one. There are 2 patients in my lifetime who actually fell down after the medicine. That means they had an injury. One of them could be watching me today. So it is possible that these medicines could have effect, which to be told to the patient, you need to be knowing it. But kindly don't go into the list of side effects available on the Google, because then you will be knowing that one side effect could even be death, and we don't want the dream to happen to anybody. So these are clinical trial side effects which you don't look into. The medicines which are available today by Indian pharmaceuticals are very, very safe medicines. These medicines are very time tested. A doctor who gives you the medicine also does not write it for the first time. He also knows the effects of medicine. So a salute to all the family physicians and physicians of this city, Mumbai, where I live in, and doctors across the country and the world, and urologists who happen to be partners in arms together, where we work and challenge and meet each other across webinars every day and in various meetings, and whose prescriptions do come in and patients do walk in for second opinion. Is always remember that you thought about a second opinion, but the first doctor you saw is the most important doctor. He is the one who deciphered your trouble. He is the one who challenged himself to identify your disease. He is the one who attempted cure. You possibly may be looking at another angle to it and may take a second opinion. But doctors always think out of the box to get you back home, to treat you and to cure you. So side effects of prostate medicines are not uncommon. The other medicines, 5 ARIs, which we give you for long term, which could be even for life or maybe for a few years, bring about shrinkage of the prostate gland, come with some degree of sexual dysfunction. So if you have any of these side effects, you could actually tell your doctor about that. So that's something which I would look at. As I come to a close, team, I almost understand that I've been answering all the questions as I move forward. Because I'm still reachable on various modalities. You could actually type it on the YouTube. You could type it on my sanjaypdr@gmail.com. You could leave it on the tweet, wherever. We would answer you all that which is required. To ladies at home, to parents and to teachers, 3 important pillars for you as men. It is important that you look into, identifying yourself, telling your problems to somebody. While teachers, parents, and ladies at home, your wives, and everybody who is taking care of you at home, they are so important for you. You should look into probably not getting your trouble by identifying prostate issues in time. Friends, it's time to come to a close because I have overshot my time for sure. I wanted to look at prostate issues can change without your permission and your knowledge. Prostate is a hormone-related regulated gland. As age changes, prostate will undergo a change. Size is one presentation which is picked up on executive health checkup on an ultrasound, but the more common presentation is lying completely with you. You are the master of your own destiny. You can pick up things in time. It is important for you to understand that. While I come to a close, I also salute the kind of work that we have taken up as a team at Kokilaben Dhirubhai Ambani Hospital, with more than 150 senior consultants and with teams that support them with centers of excellence and with non-visible teams to you, which includes right from A for anesthetist and P for pathologist and R for radiologist and U for ultrasonologist. You should dial U for urology if you have trouble. See your urologist in your cities. Identify yourself for your kidney, ureteric, bladder, prostate, and your external genitalia issues. Identify yourself in time and probably get well. I would come to a close because you can only get well if you reach in time. Don't postpone health. Health is to be brought to the front row seat always. We can't buy health. We need to probably safeguard our health by reaching the healthcare facilities in time. Healthcare facilities are doing very well. As we go to the next level, possibly I will come back to you at 5 o'clock on the YouTube channel for which notification could add on. And you could actually subscribe to a channel which I requested. And we could move forward in various awareness drives which we could look at. I have not talked about ladies even a wee bit. I would come back to that on the next Sunday, on 20th. And look at 5 o'clock talking about ladies and urinary issues, which they are shy about and which they suffer. Dr. Reddy's lab, thank you on a very short notice to have come and promoted this. This actually helps us to go to various places. I just saw my phone. There are my colleague urologists and patients from Kenya and Nigeria who are logged in here. So thank you so much, India. Thank you so much, various cities. And thank you so much, colleagues and friends. And thank you for your compliments, Sony, and everybody who have actually put in such wonderful compliments. I could not have read that because I was keeping my focus on a Sunday evening because I need to let you go now. Thanks and bye.